Let's give that a try. That's better. Thank you. Good morning. I'll call to order the September 21st, 2021 meeting of the Santa Barbara County Board of Supervisors. Madam Clerk, please call the roll.
Supervisor Hart.
Here.
Supervisor Hartman.
Here.
Supervisor Lavanino.
Here.
Supervisor Williams.
Here.
And Chair Nelson.
Here. At this time, please stand and join the board and pledge allegiance to the flag. Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next item of business is the approval of the minutes from the September 14th, 2021 meeting. Can I get a motion?
Move approval.
Second. Any discussion? Seeing none. All in favor signify by saying aye. Aye. Motion passes unanimously. Madam Clerk, are there any announcements or changes to our agenda today?
Chair Nelson and members of the board, I just have a couple quick announcements this morning. I would like to remind the public that our Board of Supervisors meetings are being interpreted and broadcast live in Spanish. We are broadcasting our meetings in Spanish both for Cox Cable subscribers in South County as well as Comcast cable subscribers in North County. Members of the public can now view our meetings in Spanish by turning on the secondary audio programming, also known as SAP or SAP, under their language settings. Lastly, I would just like to remind the public who are participating in our meeting today of the board's updated methods of public participation. For the Board of Supervisors methods of public participation and to provide public comment on general public comment or an item on the board's agenda, please see page 2 of our agenda. Members of the public can now attend meetings in person in both the Santa Maria Board Hearing Room chambers as well as the Santa Barbara Board Hearing Room chambers. Please note, on September 5th, 2021, a new county health officer order went into effect requiring indoor mask usage for anyone over 2 years of age, regardless of vaccination status. If you attend the board meeting in person, you will be required to wear a face covering or mask at all times, regardless of vaccination status. Information regarding how to properly wear a mask has been posted throughout both locations. As a friendly reminder, masks should cover your nose and mouth. Wear the mask from the bridge of your nose to all the way under your chin. Tighten any loops or ties so the mask is snug. If you do not have a mask that fits properly, we will provide you with one. Individuals that would like to provide verbal public comment virtually may do so via Zoom by registering in advance via the link available on page 2. After registering, you will receive a confirmation email containing important information about joining the virtual meeting. Once the chair has announced the item you want to comment on, please join the meeting with the information provided in the registration confirmation email. You will be placed on mute until it is your turn to speak. The clerk will call you by name. When removed from mute, you will hear a notification that your line has been unmuted. If you are using a touch-tone phone, you may need to press *6 to unmute yourself. Again, if you're using a touch-tone phone, you may need to press *6 to unmute yourself. Each person may address the board for up to 3 minutes, and this is at the discretion of the chair. If you have any questions, please contact the clerk of the board's office at area code 805-568-2240. Again, that's 805-568-2240. And that concludes my announcements for today.
Thank you, Madam Clerk. The next item of business is the County Executive Officer's Report. CEO Miyasada, do you have anything to report today?
Chair Nelson, just quickly, I think some of our residents were notified of a possible PSPS event by PG&E. It was very limited in our county, only affecting 19 customers. And this morning we did receive an email from them saying due to improved weather conditions, PG&E has delayed the decision for the PSPS to customers in Santa Barbara County, and they will be revisiting that, relooking at the weather conditions this morning. So just wanted people to know that.
All right, thank you. Supervisor Lavanino?
Thank you, Mr. Chair. I just wanted to take a second to congratulate a couple of our county employees. They were honored by the Santa Maria Elks Lodge this last week during their Law Enforcement Appreciation Night. And they were Santa Barbara County Sheriff Detective Jonathan Fleming. And then from Santa Barbara County Probation Department, we had the Deputy Probation Officer of the Year was Lucia Esparza. And then from the Santa Barbara District Attorney's Office, District Attorney Paul Zealous. So just wanted to highlight those individuals and also to thank the Elks Lodge, of which I'm a proud member, for honoring our county employees and our local law enforcement.
Thank you, Supervisor Avenino. The next item is the approval of the administrative agenda. Do any board members have any items to pull? See none,
I've got 823.
Okay, 823. Madam Clerk, do we have any items from the public?
Chair Nelson and members of the board, we have no requests to speak on the administrative agenda from the public.
All right, Supervisor Avenino, can we encompass 823 into the entire motion? Okay, can I get a motion to approve the administrative agenda?
So move.
Second.
All in favor signify by saying aye.
Aye.
Motion passes unanimously. Madam Clerk, will you please read item 823 into the record for comment from Supervisor Avenino?
Chair Nelson and members of the board, administrative item number 23 is brought to us by Supervisor Lavanino. It is to consider recommendations regarding the approval of a contract with Santa Maria Fair Park for the 2021 Veteran Stand Down.
And Mr. Chair, I just wanted to take this opportunity to highlight October 16th is our 9th annual Veteran Stand Down event. There's some county employees that play a very significant role. I especially want to thank Frank Mejia and Heather Gardner, as well as Amy Lopez. They've been there since day one, and want to actually just thank all of our partners. We're actually adding some new items this year. One of them, of course, would be COVID testing, and also you can get your COVID vaccination shot there. So once again, this event is open to all veterans. It's there are specific things there that are geared towards our homeless veterans and those most in need. But every veteran is welcome to show up October 16th. The gates open at 9 o'clock. Everything from haircuts and showers and taking care of your pets and your kids to medical, dental, mental health, employment opportunities, housing. If there's a need there that you have that isn't being filled at Stand Down, let us know and we'll make sure we take care of that. So anybody that's interested, sbcountystandown.com. There's a link there to also to Walmart that if you would like to donate some items, we can take care of that. You don't have to do anything but give us your credit card number and we'll take care of the rest. But just wanted to thank all of our employees that donate their time and energy. Thank you.
Thank you, Supervisor Avenino, and all the work that you're doing in that effort. The next item is administrative item number 27. Madam Clerk, will you please read administrative item number 27 into the record?
Chair Nelson and members of the board, administrative item number 27 is sponsored by Supervisor Hartman and Supervisor Nelson. It is to adopt a resolution proclaiming the month of September 2021 as National Recovery Month in Santa Barbara County. And joining us today in person, we have Amy Lopez, Veronica Urabi, Katrina Zamora, and Maria Gonzalez. And if you could please make your way to the podium. And I'll go ahead and read the resolution into the record. Whereas the Santa Barbara County Behavioral Wellness Department provides, in partnership with community-based organizations, a continuum of care which includes the prevention, intervention, treatment, and recovery from mental health and substance use challenges, promoting the message that behavioral health is essential to wellness. And whereas mental health and substance use disorders affect Santa Barbara County and all communities nationwide. And with commitment and support, those impacted can embark on a journey of improved physical health, emotional health, and overall wellness. And whereas this year is Recovery Month theme, recovery is for everyone, every person, every family, every community, celebrates all people that make the journey of recovery possible and spreads the message that people can and do recover every day. Through Recovery Month, people become aware and able to recognize the signs of mental health and substance use disorders and encourage people in need of recovery service to seek help. And whereas the County of Santa Barbara Behavioral Wellness Department collaborates with partner agencies and community-based organizations in all areas of the county to ensure everyone has an opportunity to achieve and sustain long-term recovery by improving their health and wellness, living a self-directed life, and striving to reach their full potential. And whereas we encourage continued collaboration and integration of services to ensure success for individuals and groups who are in long-term recovery. And whereas a Recovery Month observance will continue the work to improve the lives of those affected by mental health and substance use disorders by raising awareness and educating communities about the effective services that are available and in celebrating all recovery achievements. And now therefore be it hereby ordered and resolved that this Board of Supervisors proclaims September 2021 as National Recovery Month in Santa Barbara County and encourages all residents to support men, women, youth, and their families who are in drug and alcohol addiction treatment and mental health recovery programs throughout our community, passed and adopted today.
Thank you. Welcome, Ms. Lopez.
Thank you, Chair Nelson and distinguished members of the board. We appreciate this every year. You are so supportive of us and the department and of our staff who work tirelessly every day to encourage members of the board to recovery. It goes, right in line with, what our mission is at the exceptional services, so all of the growing safe, healthy, and prosperous life. So we appreciate your support. I know we introduced them, I want to introduce who I brought with me today. So I have Catherine Zamora, who leads our prevention department. She works with adolescents in the community. We have Maria Gonzalez, who is our newest member to the team. She also will be working in prevention, so she'll be working doing outreach in public schools. And we have Ryan, who is a care coordinator, who does direct client services every day, helping clients navigate our system. So we thank you for your support, and we also want to applaud all of our providers in the community who are delivering services day in and day out. So
Thank you, Ms. Lopez. Thank you all for being here. We appreciate your work. Thank you.
Thank you for your work.
All right. Well, now it brings us to the time for members of the public to speak on items that are not on the agenda. Madam Clerk, are there any requests to speak on general public comment today?
Chair Nelson and members of the board, yes, we have 4 requests to speak on general public comment today.
Okay, I'll go ahead and close public comment and invite the first speaker.
And if members of the public who have registered to speak on general public comment today could please log into Zoom now and provide their comments, that would be greatly appreciated. We are going to begin in Santa Barbara with Katie Mickey, and then we will go to Zoom for Maria Kessner. Katie?
Welcome. Ms. Mickey, when you're ready.
Supervisor Williams, we thank you for writing to Governor Newsom requesting he veto 2 terrible wireless broadband bills, SB 556 and AB 537. Remaining County Board of Supervisors, we request that you do the same. I quote Larry Ortega, President of Community Union. Top officials formerly with the California Public Utilities Commission have told me that the fees assessed on ratepayers and paid by the state's utility have not been audited in at least 10 years. No one within the CPUC, the California Public Utilities Commission, can confirm to this very day if fees collected from ratepayers are fees paid by the state's utility. The wild, wild west of the information age has led to the digital divide crisis of today, giving the wireless industry more deregulatory authority while the entire checks and balances within the CPUC remains out of whack, and that is irresponsible. Dismantling our regulatory agencies' credibility even further is their inability to confirm if the fees collected from landline customers for upgrades are upgrades that were actually made. The CPUC's network exam published in 2019 found the smoking gun that says fees collected from ratepayers were not used to make upgrades to families living in the digital divide. Not fulfilling upgrades is the root cause why millions and millions of children could not connect to the internet during last year's pandemic crisis. Said differently, AT&T and Verizon pre-Frontier have had the luxury of being in a deregulated regime over the last decade with the expectation they would build out a world-class telecommunication infrastructure. Make upgrades to the network. The upgrades never came. So what happened to all the money? Almost $1.5 billion in alleged overcharges has been estimated just in the last 2 years in California. Until the governor can address the root causes of the digital divide, no further deference to the telecommunication industry should be gifted. SB 556 and AB 537 represent a gift undeserving to an industry who has and will continue to fail millions of our children when no accountability is present. And in my written public comment, I share with you these pictures. I'm giving them here visually for you to see, but this is part of where the money went, was in special checks to Senator Ben Huso, Chairman of the Standing Committee on Energy, Utilities, and Communications. And ANTT presented a check of $45,000 grant to his district. And then the second picture is the principal co-author of AB 537, Assemblymember Quirk, getting a $500,000 check for a project in his area from AT&T. So there is a solution to closing the digital divide, and that is fiber to the premises. Please
Thank you, Ms.
join
Court. Thank you, Ms.
Supervisor
Mickey.
Williams and Mary Murillo and write to our Governor Newsom
That
as
is your
soon as
time.
possible to veto SB 556 and AB 537. Thank you.
Thank you.
We will now go to Zoom with Maria Kestner to be followed by Jeffrey Schwartz, who is our final speaker.
Ms. Kestner, when you're ready,
Can you hear me?
we can.
Okay, good morning, Board of Supervisors. I just wanted to point out that once again, we are running into, my daughter and I were denied entry to the board meeting last week. She is disabled. She is basically exempt from wearing a mask. And the health order number 2021-10.4, effective date September 5th, 2021 at 5 p.m., clearly states that she is exempt. On page 4, bullet point 4, number I, persons with a medical condition, mental condition, or disability that prevents wearing a face covering. We were actually denied entry and we were directed to the courtyard where the county has a setup for people that cannot wear a mask. And this goes directly against your own order. And I just wanted to point out again, just like you denied us our First Amendment right to clap in approval of a comment, you are again violating the rule of law in your own county order. And I think this needs to be pointed out because I think the public needs to realize that individuals that are government employees or representatives, they ignore oftentimes that are ignorant of the rule of law and are operating under the reputed authority of the government are basically the biggest violators of the rule of law on a regular basis. And that was basically my public comment. Thank you very much.
Ms. Kestner. Madam Clerk.
We will now go to Jeffrey Schwartz on Zoom, who is our final speaker.
Mr. Schwartz, when you're ready,
Can you hear me?
we can.
Okay. Again, I'd like to give credit to Chairperson Bob Nelson for at least mentioning and talking in positive language about human rights, constitutional rights, natural rights, and bodily autonomy, the right of individual people to decide for themselves what goes into their body and not the government deciding what goes on into their body. So Chairperson Nelson is the one person on this panel who is talking about these things, and that's really good. But the rest of you don't seem to be talking about this at all. We hear some of the people on this board saying, "Oh, we govern through science," but that's not what you're supposed to be doing. You were forced to swear to say an oath to defend the Constitution and not to defend science, and especially science from your government paid or industry paid people. And one of your people on the board admitted she will not even listen to any dissenting opinions because she thinks there's a consensus. And if anybody's outside the consensus, she doesn't even want to listen to it. So that's her restricted science. But you're not supposed to be governing by science. You're supposed to be governing according to the Constitution. And the Constitution clearly lays out our individual rights. Do you really want to set up a two-class society? Because that's what you're doing. And the Germans did this in the 1930s under their awful leader, as you remember him. But they had a term for this. It was called the Untermensch. And this was a Nazi term for the non-Aryan inferior people. It means in German, it means the underman, or like the subhuman man. And so are you considering anyone who doesn't take these injections subhuman? Because you're treating us like that. You're saying we can't travel, we can't go on to transportation, we can't come to your meetings if we don't cover our faces, which for some people is either against their religion or against medical advice. So you are creating a two-class society. And I'm wondering, how far is this going to go? Are you going to insist that we go into locked quarantine facilities? Very similar to what happened in World War II, where the Japanese people, Japanese Americans, were interned in America in large numbers. They're already building these locked facilities all over Australia. So is this going to happen here? And I think you need to start talking about our human rights, just like Bob Nelson is. I want to hear everyone say, how far is this going to go? How far are you going to go discriminating and persecuting the people who refuse to take these injections?
Thank you, Mr. Schwartz. That is your time.
And that was our final speaker.
All right.
Oh, Mr. Chair, I should have said under A26, but I did want to not let that pass by. I don't think it is, and I'm glad that the board passed that along with the consent calendar, but it is National Drive Electric Week, the first week in October. And it's no accident that it's the same time as Clean Air Day. It's right after Clean Air Day. I think that, and it's for people that are thinking about saving a whole lot of money now that gas is approaching $5 a gallon. It's a great opportunity to get out there, a lot more selection of cars. And because northern Santa Barbara County is already getting their energy from 3CE, that means that people who live in the northern half of the county can already get better vehicle incentives. Check out the website for 3CE or email myself or Joan Hartman, who are your two representatives on the 3CE board. And shortly, beginning next month, South County residents will also be getting their energy from 3CE and can get those same incentives for electric cars or for electric charging through our energy provider community, Central Coast Community Energy 3CE.
Thank you, Supervisor Williams. Back to Madam Clerk.
Yes, thank you, Chair Nelson and members of the board. And just for clarification in regards to Supervisor Williams' comments, that was for administrative item number 26, sponsored by Supervisor Williams to adopt a resolution proclaiming September 25th, 2021 through October 3rd, 2022 as National Drive Electric Week.
Thank you for keeping us on track. With that, that's the conclusion of the administrative agenda and public comment. The next item is departmental item number 1. Madam Clerk, will you please read that item into the record?
Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019, COVID-19.
Welcome, Dr. Dovernesso.
Good morning, Chair Nelson and members of the board. Madam Clerk, may I have my slides? Next. This morning's briefing will go over the COVID-19 dashboard, give your board an update on the booster conversation, update on our testing capacity, as well as giving your board an update on our flu season. Next. From our dashboard, As of September 20th, we have 76 new cases, and this is a decrease from the 2-week average of 105. We have 473 active cases, and this is also a decrease from a 2-week average of 554. That brings our total cases to 41,402. Our testing, our case rate per 100,000 as of September 16th is at 16, with a testing positivity at 4.2. Unfortunately, we reported 3 new deaths. These are 2 individuals, 50 to 69 years of age, and 1 individual in the 70 plus year of age range. The individuals resided in Orchid and Santa Maria. We currently have 45 individuals hospitalized with 12 in the ICU. Our total death is at 497. Next. This is our case rate over the spans of the pandemic. We are currently reporting our case rate at 16. So that is a decrease of roughly 35% over the last 2 weeks. Next. This is comparing case rate by vaccination rate as of September 9th. The top line, the red line, describes the trend for unvaccinated individuals, and the case rate is at 30. Our county-wide rate is the middle line, the gray line, so it is at 17.2. The lowest line, the blue line, is for vaccinated individuals at 6.2. So as of 9/9, cases were 4.8 times more likely to be unvaccinated than vaccinated. Next. I'd like to share with your board, this is sometimes it's always good to compare our case rate with at the state level and at the national level. So the blue line describes, and this is case rate per 100,000 per day with a 7-day average with no lag. And so the top line, the blue line, is the national rate at a case rate of 42.79. And California is described by the orange line with the case rate at 14.56. Our county, Santa Barbara, is described by the green line. And again, our case rate is at 16.68. So this is really a good depiction of what's happening around us. And if you are interested, SLO case rate is at 27 and Ventura is at 15. Next. This slide describes our hospital capacity as of September 19th. We have 63.2% of our hospital beds in use, and we have 70.1% of our staffed ICU beds in use. So our hospital capacity has slightly improved this week, but we are still very close to the red zone. Next. Our vaccination rate as of September 19th, we have 67.4% of eligible Santa Barbara County residents as fully vaccinated. And again, it's still roughly 1 in 3 eligible persons in Santa Barbara County is still unvaccinated. Next. We continue to see modest increases at the zip code level, and vaccination level by zip code is available on a daily basis on our public health sbc.org under the vaccination tab. And you can hover over a particular zip code and see and track the changes in those particular zip codes. Next. So from the previous slide, this is the highlight. We are distilling key takeaways. The greatest percent increase from previous week were observed in the following zip codes: in the Los Alamos, the Santa Maria, Casmalia, Antonio, the Guadalupe, Santa Maria, Sisquoc, and Gary, and lastly, the Lompoc, Vandenberg Village, Mission Hills, Concepcion, and Acorn. We are seeing more than what we were anticipating. And so this really, again, is a combination of continued effort and outreach with our partners in these particular zip codes, as well as the availability of the mobile vaccination clinic, as well as community members being ready to be vaccinated. Next. Current outbreaks. We are reporting 58 active outbreaks, with 9 among businesses, 28 among schools, and 21 among congregate living facilities. Next. With regards to the Pfizer booster shot, the last Friday, the FDA advisory panel voted to recommend the Pfizer booster shot for 65 years and older, or those at high risk of severe COVID-19. The panel also supported authorization. So this is not a vote. They supported authorization for healthcare workers and others at high risk of occupational coronavirus exposure. So booster programs cannot begin at the local level or at the state level until the FDA has made their formal approval and CDC issued the clinical guidance. Next. I'm just wanting to share with your board that we continue to prioritize preserving our testing capacity in our county. And so what this means is that we continue to work with employers so that they can have a direct contract with the state for free employer-based testing. We continue to support our Goleta Valley Community Center, our Buellton Community Center testing, Santa Maria Fair Park testing, as well as supporting our 2 testing sites based out of our healthcare center in Santa Barbara and in Lompoc. Next. We are happy to announce finally that we are adding to our testing capacity. So it is confirmed that the minibus will be coming next Monday on September 27th. It will be parked at Direct Relief in Goleta. The capacity is 168 tests per day. It will be open from 9 to 5 Monday through Friday. Appointments can be booked at our website, publichealthsbc.org/testing, or walk-ins are accepted as long as there is space available. Next. Well, it is once upon us again, the flu season. The Santa Barbara County Public Health Department wants to remind your board and our community that the flu season has arrived. Flu vaccination will be very important, especially because we are still in a pandemic, to reduce flu and to reduce the overall impact of respiratory illnesses on our community. Getting the flu vaccine is an essential part of protecting our health and our family's health. Flu vaccination reduces the risk of flu illness, hospitalization, and death, in addition to other important benefits. The CDC continues to emphasize the importance of flu vaccination beginning September and for the entire flu season. Flu activity can peak in the coming months, in particular in December through February, and can last until May 1st. It takes about 2 weeks after vaccination to develop antibodies that provide protection against flu. So the best action is to get to be flu vaccinated before the flu virus begins to circulate in our community. And we have listed places where individuals can get vaccinated. It is so convenient. The flu vaccine is available from your regular healthcare provider as well as retail pharmacies. And in addition, many employers like our county, schools, colleges, universities also offer them. And if individuals don't have a doctor that they regularly see, and flu vaccines will also be made available through our local health department and our vaccine clinics. And there are pictures from previous years where your board participated in our flu season kickoff by getting vaccinated. Next. I'd like to end my briefing by sharing with your board an example of our outreach. This particular effort focuses on the facts about COVID-19 vaccines. This graphic is available in both English and Spanish and will be shared widely through our platforms and our partners. And it really just addresses some of the facts that we want to make sure that everyone is aware, that researchers took no safety shortcuts. Large studies show that the vaccine is safe. Another fact, that the vaccine helps your body produce antibodies, but cannot change your DNA. Another fact, the vaccine cannot give you COVID-19 because it does not contain a live virus strain. Fact, it does not have egg proteins and can be given to people with egg allergies. Fact, the vaccine can cause mild side effects that resolved in a few days. And lastly, fact, there is no evidence that the vaccine causes infertility. So with that, my briefing ends.
Thank you, Dr. Dovernoso. Questions from the board?
Yes, Mr. Chair.
Supervisor Hart.
Yeah, I just had a question for Dr. Dovernoso about the flu vaccine. Are you planning to come back to the board to give us our shots at a future board meeting?
Yes, our team is ready and available to join me at our next board update in October. So we will be there with flu vaccines for any board members or those in attendance who wish to get a flu vaccine.
Thank you very much for that opportunity.
And I'm going to remind everyone to wear short sleeve shirts.
Thank you, Supervisor Hart. Any other questions from the board? Right. I had a quick question about, there was a lot of talk last year about the flu season and having a very low presence of flu in the community. And, I'm looking on the dashboard, it seems that is also true. What is the expectation, understanding this last year and what we're looking at moving forward?
Right. Great question, Chair Nelson. So what we experienced last year was very unique in that we were still, there wasn't a lot of mobility in the community. We were still under quite a few restrictions. Everyone was masking, social distancing, and really limiting their outings and their gatherings. So that on top of the flu vaccine really precipitated us in a good space where we did not see a lot of flu infections and flu deaths in our community and in other communities as well. This year is a little bit different. We, for the most part, have resumed normalcy. There is no restriction on gathering, social distancing, and people have resumed for the most part their normal, typical activities. So we want to make sure that everyone will continue those precautions as well as take the flu vaccine so that we can keep flu circulating at a very minimal level.
Thank you. Have we had any positive flu cases in the county? Today?
Not that I am aware of.
Okay, thank you. All right. I also had some questions for HR on the testing and vaccine policy. I understand that I've got a lot of questions from various employees in the county over the last couple of weeks on the progress, and I think HR has a slide that they can provide for the public and for our employees.
Good morning, Chair Nelson and members of the board. This is Maria Elena, the county's HR director, and I actually have for you a presentation, more of an update in terms of where we are with the policy, the county employee vaccination verification and testing policy, as well as specifically the question that you had for us, which is on the exemptions. So that's what I'll cover today. With me for today's update is Joe Pisano, our Division Chief for Employee Relations, Carlos Silvas, Employee Relations Manager, and Victoria Tuttle from County Council. And so the next slide, please. So here we have, this is specifically the question that you had for us on the exemptions. So it can get a little complicated and can be confusing. At the end of the summer in July, we had the state health order start. We received the beginning of 3 state health orders at the end of July, and into August, there were a total of 3 state health orders. And basically, those state health orders were for a very specific group of our county employees. And it was pretty much a vaccination mandate that for our public health, our PUF clinics and Be Well, specific employees in our correctional detention and Santa Maria Juvenile Hall and Los Prietos Boys Camp. And it's a vaccination mandate that said that you had to have your vaccination, and if not, you could have exemptions, and there were only 2 exemptions based on medical or religious reasons. And in order to get those exemptions, we identified a declination form, and through that declination form, you'd still need to go through weekly testing. So it was a very specific group of our employees. It was not the whole county, it was just these specific groups. And it was a mandate for vaccines. And the exemptions for those are just these 2, medical and religious. And the form for that is through this declination form. And then it was weekly testing. So that was a very specific group. And there are the deadline for that, for those are coming up September 30th for most of the clinical groups. And then for the correctional and detention, that's they have until October 14th to ensure that we meet those mandates. So then at the end of the summer in August, a couple of weeks ago, right, August 27th, our county board approved the county's employee vaccination verification or testing policy. So it was not a vaccine mandate, but employees had to verify to us that they had their vaccines Or if they didn't want to show us any kind of documentation, they could choose to go through a weekly testing process. And so exemptions are really not necessary since we're not mandating the vaccine. And again, there's no necessary exemptions for testing, except for we are creating a form that if our employees are not comfortable with the PCR testing, that we will consider an alternative for that PCR testing, but it is not an alternative for the testing itself. Our employees still have to have some kind of testing on a weekly basis because that is the policy. You show documentation or you go to weekly testing. So the PCR can, if you don't want to do the PCR testing, we can look at an alternative type of testing. And we are still developing that form, and we hope to have that before the deadline of September 30th or soon thereafter. So those are the two different policies, the mandate from the state health order and then the county's policy for the rest of the workforce that did not fall under the state health order. Then we had our own local health officer order that has been in place for the overall county around face masks that went into effect and will be expiring on October 5th around face masks, that all of our employees need to be wearing face masks while indoors performing their work in buildings, county buildings. The exemptions are if our employees are working alone in an enclosed office with a door without any other employees in that office, or when they are actively eating or drinking. And if there are issues for our employees with the face mask requirement, our employees can file through or request through Title VII or the ADA accommodations process. And there are protocols for that our employees can follow to request those accommodations. So since August 27th, we have been fielding numerous questions from both our union leadership and our department managers and department directors. And we are answering those questions, and we are posting those on our HR intranet, as well as the forms. The declination form is there, and that's our link there. And when we finalize the request for alternate COVID-19 testing, that form will also be there. We will continue to meet with our department representatives as well as our union representatives. And so if our employees have any questions, really the best approach is to for the employees to meet with their supervisors and managers, the HR rep at the department level, union leadership, because our ER teams have continued to meet with them. And then, of course, county HR. The HR internet site is going to be a good place for them to get information and answers to their questions. So that's our, in terms of the policy distinction, because it can get a little confusing. I thought it'd be helpful for us to take a look at our numbers in terms of who does this policy impact. So the next slide, please. So here's where we stand as of yesterday. The numbers have adjusted a little bit from the last time I presented the numbers, and that's only because our elections workers are no longer with us. Several of our seasonal workers are no longer with us. So the total county workforce has decreased, and that overall helps the testing numbers. So now we are at 72% vaxxed and verified, as compared to, we were at the end of August, we were at 49.3% vaxxed and verified, and now we're at 72. And so currently we're at 28% if we were to look at our testing population. If we say those that are vaxxed and verified, or the rest will be considered our testing population. However, the deadline for our departments was last Friday to get us these numbers, but we're still processing a few more departments. We have 3 or 4 that are still trying to collect those numbers. So we think that these numbers will shift. Included in the 28% are also those that employees have the first shot, but they don't yet have the second shot. And as you know, the definition of fully vaccinated is when they have completed the 2 shots and are beyond the second shot. So those individuals are still not considered fully vaxxed. And so they're kind of still in that 28%. So the numbers will adjust a little bit as we head into the 9/30 deadline date. But we're looking much better than we were in August. And so these numbers will continue to adjust. So as we look at right now, the 28%, let's take a look at the next slide that will tell us what our testing process is going to be for this 28%. Next slide, please. So here's our testing implementation update for you. So based on what our departments were saying to us in terms of operational needs, we've identified locations where we will have the testing done. We're looking at the Santa Barbara administrative building location, since that's a great number of employees, a pod of employees. We're looking at Santa Maria, Calle Real, and then we have department specific that based on operations and total numbers, the fire, sheriff, public health, public works, and social services are departments that will most likely run their own testing locally, as that will help them operationally. And we've have asterisks on all of this because locations and times need to be determined based on the actual numbers of employees that need to be tested, and we are still processing that. We are happy to report that we have contracted with Color Platform and the Valencia Laboratory as our vendors for the dashboards. That's where we will manage the results of the testing. Valencia Laboratory will provide us the drop boxes in the Santa Maria area and the Santa Barbara area, and they will test our specimens. We have made the decision to hire medical assistants for our county locations, and this will help in ensuring that we have observers and record keepers for this process. They will deliver to the drop boxes. They will be trained and have the appropriate protective equipment that they will need, so that managers and supervisors aren't the ones that are actually doing the observing. If you recall, the test is a self-test, but someone still needs to observe and record and make sure that the test kits are handed out appropriately and the employees are instructed correctly, and that the record keeping and all of that is done adequately. And so here's the implementation. We need to order the kits, and you've heard on the news that there's a bit of a backlog with the kits because all employers are having to go through this. The county is not the only employer. And so Color Platform is not allowing us to just throw a number out there for the total number of kits that we can order. They really want us to be very diligent and specific in terms of the total kits we can order. And so having that number nailed down is really important. And so once we have that, we can order, and then employees can register onto the Color Platform site. Employees will get their emails so that they'll know when to go. Weekly appointments will begin. Then the dashboards can start getting managed. And then should there be a positive, we already have the protocols through the Cal OSHA standards as to what management is informed as to what we need to do and follow should there be a positive result. So that's our process right now. But, the ground is always moving, and we've got a good team in place with partnerships with county council and my employee relations team that we've been pretty agile in adjusting and adapting as we need to, always in communication with the unions. They've been good partners as well. And our job is to make sure that we keep the lines of communication open. And we need to adjust as we need to when we get more information. But so far, that's the game plan. And I'm available for the next slide and to answer your questions if you have any questions for me.
Thank you, Ms. De Guevara. Any questions from the board? Supervisor Lavanino?
Thank you, Mr. Chair. So even though we're at 72%, that still leaves a little over 1,200 employees. It looks like that we're talking about testing. So curious, out of that 72, up and above the 72%, do we have any idea how many have already taken one shot so that they're on the path to getting out of our testing?
Yes, the number is somewhat small. It's not going to make a big dent right now from what we've looked at. Okay. Again, we still have 4 departments and one of them is a pretty big one. So I'll know more later.
Yeah. And then I don't know if this is for Dr. Reynoso or not, but is it proper to be getting tested while you're in the protocol of getting your shot? So what I'm saying is, like, the people that are getting their shots, they're still, from what I'm understanding, we're still going to require them to be tested until they're 2 weeks past their second shot. So does it make sense to test people as they're in that protocol?
That's a great question, and I don't have an answer to that, but I will check with my team for a response right now.
Thank you. Any other questions from the board? I've got a couple questions for Ms. De Guevara. If you can go back to slide, I think it's slide 2. So that first column there, the state health officer order requirement, do we have any idea of how many employees fit into that?
Let's see. I don't have that right offhand. Carlos, or do you happen to have that?
No, we don't actually have that number.
Okay. Because I guess I was kind of concerned because I think there's been some confusion out there on which column some of our employees fall into. I've heard from people outside of those departments being asked to fill out the medical and religious exemption piece, which don't seem to fall under that state health officer order. So I think maybe some clarification might be helpful for our employees so they know where they're at with that. My other question is with the medical and religious exemption. What is our certification process on that? Are we accepting self-certification of a medical or religious exemption?
For the medical exemptions, we are requiring a physician's note or verification of such, and we go through that accommodation process for that. And for religious exemptions under the state health officer order, it's simply a completion of the declination form claiming a religious exemption.
Okay, so no further verification beyond that?
Not at this time.
Okay, thank you. All right, that answers my questions. Supervisor Lavanino?
Well, I think that brought up another question, kind of putting those two together for me. And I guess we don't have the information, but something I'd like to see is, out of that 1,200 employees that we have, how many of them actually fall into the first bucket that are required by the state? So that way, that kind of limits us knowing how many we're going to have to test. So I'd just like that information later. Thank you.
All right.
Okay.
Thank you. I think at this time we'll go to members of the public that are available for public comment here or.
Chair
there's some-
Nelson?
Yes, Dr. Del Reynoso, please.
Yes, Supervisor Lavanino, through the chair, I did receive a quick response from my team. And yes, while the staff is getting their vaccine, they will still need to test. You are not exempt from testing until you are fully vaccinated, and that is 2 weeks after your second shot.
All right. Thank you, Dr. Del Reynoso.
Yes.
All right. So, Madam Clerk, can we go to for public comment on this item? How many speakers do we have?
Chair Nelson and members of the board, we have 4 requests to speak on this item.
Okay, I'll go ahead and close public comment and ask the first speaker to join us.
Chair Nelson, members of the board, as noted, we have 4 requests to speak on this item. And if you are a member of the public and have registered to provide comments on departmental item number 1, our COVID-19 update, please log into Zoom now. We will begin with Maria Kessner to be followed by Jeffrey Schwartz.
Ms. Kessner, when you're ready.
Good morning. Can you hear me?
We can.
Okay, so I sent you my public comment last week, and I'm going to read what I wrote you. The entire argument rests on the fact that this is the test, the PCR test on EUA status that this pandemic rests on, which is now null and void. The PCR test that is currently under EUA status and will be retracted at the end of this year. Not some new approved PCR test they are now going to use from here on. And basically, I also included to you the Corman-Drosten report review, which identified 10 flaws involving the RT-PCR test that has been used for identifying COVID-19 all this time. And it was basically identified by 22 top scientists in the world, okay? So there's a total lack of fact deduction, and enormous censorship on scientific fact-finding here is a huge red flag. There is no consensus in the medical and scientific world on COVID-19. There is solely a consensus in the bureaucratic world on COVID-19, which makes it highly suspect of this being a political agenda with an army of, between quotation marks, useful idiots, that was a term used during the communist revolution, excuse my French, stepping in line to implement this tyrannical agenda. Klaus Schwab, founder of the World Economic Forum, surely published his book, COVID-19, The Great Reset, on this entire premise that COVID-19 is to be used as a pretext to rein in some ideological agenda coming from global elitists who use the political class to materialize this, bypassing the consent of the governed. I'm an immigrant from the Netherlands. In the Netherlands, they now instituted a QR code for individuals so they can have their ID, they have a digital ID, and their entire medical history can be tracked by governments. Okay, and we're not consenting to this agenda, and we're not going away. I would like to say we expect that you do your homework on the science and answer our questions on what is the foundation you base your blanket policies on, which have gone unanswered through our California Public Records request and are met with slideshows that could be picked apart by anyone who pays attention. And I would like to also remind you that the slideshows you put up, where are your sources? Where do you get these numbers from? Your sources are not identified on your websites, and we're going to address this. We're going to follow up on our public records request because this is outrageous. This is pseudoscience. Anybody that questions anything that comes from government bureaucrats is silenced. And there are thousands, literally hundreds, thousands of reports of medical professionals that are questioning. And as you can see, the FDA is retracting.
Thank you, Ms. Kessner. That is your time. Thank you.
And unfortunately, Jeffrey Schwartz has not rejoined us, so we are going to Amy Smith to be followed by Jennifer Smith.
Welcome, Ms. Smith.
Can you hear me?
We can.
Can I just ask you, since I joined late, is this the health report or public comment generally?
This is in regards to the COVID-19 update.
So, right.
Please keep your comments to the COVID-19 and the county response.
Okay. I I am very concerned that it has not been demonstrated that this is a more serious situation than a normal flu. And all of these protocols are being put into place. Coercion is being put on employees through the testing regimen to get this gene therapy that's being claimed as a vaccine. But, the definition of vaccine had to be changed in order to consider it a vaccine. And just as the definition of pandemic had to be changed in the last decade to make this a pandemic that we would respond to in a different way than we would to a typical bad flu year. So this is very concerning pattern, and I don't see evidence being brought forth that this is a unique situation that warrants all of these major changes to the way the county is functioning and the way employees are being treated. And coming from even the president of the United States telling companies what to do as far as their employees' health, turning employers into doctors, you guys into doctors. That's not what your experience set is. That's not some decisions that you should be making. I understand that people in the health department are doctors, but they are apparently not looking at all the evidence. For example, the fact that the breakthrough so-called cases, which is another trick of language to call it a breakthrough case when a vaccinated person gets the sickness instead of a sickness, a case, is to try to give the impression that the vaccine is protective in a way that hasn't been demonstrated to be, especially with the Delta variant. So now that we know that it is not protective, why are we coercing people to get it? Why are we not testing the vaccinated just as we're testing the unvaccinated, since both are capable of spreading it, as even the health officer has said in the past on these meetings? So this bias shows to me, or makes it appear to me, that this is about promoting a product, about product placement for the pharmaceutical industry, and not about public health. And then it's also about surveillance and whetting the appetite for data that the big tech industry that's grown up around us and is monitoring more and more aspects of our life would like to know about people's health information, religious beliefs, all kinds of private things that you have no business asking for if we have a right to privacy in the United States, which the Bill of Rights claims we have. So I continue to be very disturbed. I continue to wonder why there isn't more being done to prevent illness. We've had 18 months. We could be helping people get off of diabetes medicines. Type 2 diabetes is very reversible with lifestyle and health. That would reduce one of the cofactors.
Thank you, Ms. Smith. That is your time.
We will now go to Jennifer Smith, to be followed by Jeffrey Schwartz, who is our final speaker.
Ms. Smith, welcome.
Hi, good morning. My name is Jennifer Smith. I'm a resident of the 3rd District, and I'm speaking today in my individual capacity as a county resident. And I'm speaking on behalf of immune compromised patients who have taken the Johnson & Johnson vaccine. As you already are aware, immune compromised patients who have taken either the Pfizer or Moderna vaccines have already been authorized to take a supplemental vaccine shot in order, and the purpose of that is to get them the equivalent protection that the general population has with a 2-dose regimen. But unfortunately, no action or guidance has been issued for the immune compromised patients who have taken the Johnson & Johnson vaccine. Unfortunately, with the way things are right now, only 7% of the nationwide population that is fully vaccinated has taken the Johnson & Johnson vaccine. And nationwide, approximately 3% of the adult population is immune compromised. So we know that this is a small minority, but it is a very vulnerable group. And the severe or moderately immune compromised, sometimes it's more obvious, right? It's people under current cancer treatment, people with severe HIV and other conditions, transplant recipients, but others who are moderately compromised are our friends and neighbors in the essential workforce. These are people who may have autoimmune conditions and take medication that suppresses their immune response. My understanding is that various hospital systems and communities across the nation have authorized immune compromised patients who took the Johnson & Johnson vaccine to take a supplemental dose of either the Pfizer or Moderna vaccine already. Now, I'm also hearing that the CDC is starting to crack down on things, and I understand that providers and municipalities are worried about liability. But I think it also needs to be considered that there's risk from inaction as well, and it's a difficult tension between getting ahead of this thing, but also waiting for the appropriate data. So I would simply ask that the county consider facilitating this group in terms of getting access to a supplemental dose. If that is not possible, I would urge county leadership to use its voice and power to either communicate with the State Department of Public Health.
Thank you, Ms. Smith. That is your time.
And we will now go to Jeffrey Schwartz, who is our final speaker on this item.
Welcome back, Mr. Schwartz.
Thank you. Can you hear me?
We can.
Okay. I'm sure many, if not most of you are all well-intentioned. You're thinking, oh, well, we're involved in a very noble effort for the common good, for the greater good. We're helping mankind. But you may not realize, but you're just pawns. And if you're naive to what's going on, this is really a ship of fools, of naive people who think they're doing good, but they're really not. And from the very beginning, this whole thing has been an assault on our First Amendment rights, on our Bill of Rights. Saying, oh, well, put on the mask voluntarily 2 weeks to flatten the curve. Well, that's false pretenses, because this has been going on for 18 months and there is like no end in sight to this agenda. And Bill Gates is already saying we're going to be preparing for the next pandemic. They already said in Event 201, 2 months prior to coronavirus ever being discovered, that they said it was going to be a new normal, that we're going to have these global pandemics all of a sudden. But anyways, you guys are pawns and there's a greater agenda here. But in any case, most Americans are starting to realize that the political mandates to wear masks, practice social distancing, take these tests, these are all gross violations of the First Amendment, the Fourth Amendment, and our Bill of Rights. For example, face masks and social distancing grossly impede our rights to free speech and peaceable assembly. In addition, many Americans simply cannot wear face masks because of pre-existing health conditions. Others believe that face masks pose a serious risk to their health and do not believe the government has any authority to force such harm upon them. Some raise religious objections, but the mask really is the precursor. It's the inching towards the vaccines, or what you call vaccines. I'm calling them clot shots or Russian roulette shots, whatever you want to call them. But anyways, people are understanding, more and more are understanding this is tyranny. This is against the Constitution. This is against the Bill of Rights. And people are going to start passive, peaceful non-compliance. For example, people are shopping mask-free. They're wearing mask exemption badges. I can help people get all the information they need about how to assert themselves. Just email me. It's Jeff, Jeff 489 at protonmail.com. So just email me, Jeff489 at protonmail.com. And I will help you figure out how to assert your constitutional rights. More and more people are simply not complying with these tyrannical and nonsensical mandates. So, and kudos to Bob Nelson for speaking up.
Thank you, Mr. Schwartz. That is your time. Okay,
And that was our final speaker.
Okay, back to the board. Supervisor Lavanino, then Supervisor Hartman.
Thank you, Mr. Chair. Well, I wanted to ask about the outbreak that we've had in the jail, and just if there's any policy changes, I was thinking we might discuss that today. I was just kind of curious if we're going to get an update on that.
CME Sara.
Supervisors, we have Under Sheriff Saul Linver online, so I know he's been part of the meeting this morning. So, Mr. Linver.
Yes, good morning, Supervisor Lavanino through the chair. We have implemented testing on every shift, so everybody that comes into work is getting tested. We currently have 60 inmates who are positive. We've had actually 3 different outbreaks, if you will, over the past month. 23 have recovered since the initial outbreak. 6 people were cleared yesterday. We will be testing inmates tomorrow from last week's outbreak at their day 7 exposure. And again, we'll be testing them at day 10 of exposure. Of the current positives, 24 are vaccinated and 1 is partially vaccinated. That inmate has received their first Pfizer shot. Out of the current 60 positives, 7 are symptomatic. 3 were taken to the hospital and given the antibody treatment. And we will be doing, we are waiting to hear back on testing from another area, the MSF. We had 90 PCR tests that were done, and we did antigen testing on them, and they all came back negative.
Very good. So when somebody gets booked, are they, I guess just what's the protocol? How do we handle the inmates?
When somebody is brought in, they are immediately tested, and then they are put into the inmate reception center. They stay there for 14 days, separate from general population. They are observed for those 14 days, and before they go into general population, they are tested.
Okay. And then from what I'm understanding, the custody deputies all then fall under the auspices of they're in the bucket of the state mandated vaccine or testing. Yeah.
Yes and no. We are testing them twice a week, the inmates. We're waiting to get discussions with CSSA attorneys as well as our attorney, because the way that the mandate reads is a facility that offers medical treatment, which is a little bit more than ours. The way it's written, the way we are doing it, or the way the treatment, again, the way it's written. So we're waiting to hear from the attorneys. But right now, we have approximately 62% of our custody deputies that have been vaccinated, and we are testing everybody every 2 weeks.
Okay.
Or I'm sorry, twice a week.
Thank you, Mr. Limmer. Questions from Supervisor Hartman?
Yes, to Dr. Del Reno. So I just wanted to follow up on Miss Jennifer Smith's question about immunocompromised people who had the J&J vaccine and whether they can get a booster, and what the future looks like for that, what more we can do.
Supervisor Hartman through the chair. Unfortunately, we do not have authorization right now from the FDA to offer the Johnson & Johnson second dose. I do know that Johnson & Johnson and Moderna, but Johnson & Johnson have published their clinical trial data and are in the process of submitting that to the FDA for evaluation. So it is anticipated that within the next several weeks, the FDA will be reviewing the data and offering an approval, and that's in the works. It's a difficult position to be in, knowing that some of our immunocompromised community members are looking to the Johnson & Johnson second dose. However, the healthcare community is quite uncomfortable doing a off-label use of the Johnson & Johnson. And so Ms. Smith is correct. When we do off-label, use, we have to report it. And so it puts us in a very uncomfortable position of doing something that is not under the guidance of CDC.
Thank you. But we expect that there will be approval soon. Does that, so that, would that happen within a month, you say? They're doing the tests or reviewing the tests over the next 2 weeks?
It's hard to say. I had read a review or an interview that Dr. Fauci provided over the weekend, and his anticipation is within 2 weeks.
All right, thank you. Any other questions from the board? I have a couple quick questions for Mr. Lindbergh. Are you still available?
I am still here.
All right, thank you. So based on the protocols that we have for inmates entering the jail, can you elaborate on how we suspect the outbreak occurred?
We are still doing tracing on that. There is the feasibility that it was an employee who brought it in. And we did test all of the employees that had contact with that module. We went back 8 days, I believe, and we did have 3 employees that tested positive.
And did you have the vaccination status of those 3 employees?
One of them had been vaccinated.
All right, thank you.
And I do need to make, I apologize, I need to make I was just notified that the inmates that come in after they're tested, they're in the IRC, Inmate Reception Center, for 10 days and then retested. And if everything proves okay, they may end up in general population, not 14 days.
All right, so are we needing to do more than just vaccination to assure spread doesn't occur in the jail?
Yes.
We're testing everybody now, right? Whether
we are
status?
Yes, we are testing all of our deputies that come to work per shift. The other thing we're looking at, and we're working with the CEO's office regarding the feasibility of giving some type of incentive to the inmates to see if we can get more inmates to volunteer to get vaccinated.
Right. Thank you, Mr. Linder. All right. Any other questions, comments from the board? Quickly, I'd like to just take the opportunity to highlight with this item that this weekend in the Santa Maria Valley, we had the Farm Day. Over 4,200 visits to over 13 locations, and organizations such as the California Farm Workers Foundation passed out free PPE, complimentary masks, and hand sanitizers were made available at every location. Public Health was also able to do a vaccination clinic, which happened at Ryder Berry's Farms, and they successfully administered 55 COVID vaccines. So I thought that was something to be celebrated and commended. And I just wanted to thank Mary Maraville and the Farm Day Committee for that outreach and that opportunity that they gave to the public. So thank you. With that, can I get a motion to approve item D1?
So moved.
Second?
Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Motion passes unanimously. All right, for the purposes of agenda management, we're going to go to item number 2. We'll take a small 10-minute break after that and try to wrap up item number 3 before breaking for lunch and closed session. And then we'll be coming back after closed session, which will be approximately an hour and 15 minutes for item D4. With that, Madam Clerk, will you please read item D2 into the record?
Chair Nelson and members of the board, departmental item number 2 is from the County Executive Office. It is a hearing to consider recommendations regarding countywide broadband strategic plan participation, American Rescue Plan Act, ARPA discussion.
All right, welcome, Ms. McGinty.
Awesome. Thank you. Good morning, Chair Nelson and members of the board. Today, we are asking you to receive and file a presentation from the Broadband Consortium of the Pacific Coast, as well as the Northern Santa Barbara County Econ Alliance, as well as REACH, and provide comments and directions on participation in the development of a countywide strategic broadband strategy, as well as determine that the above actions are not a project under the CEQA Environmental Quality Act. The presentation today is going to be presented by the project lead, which is the Broadband Consortium of the Pacific Coast. But before we jump into that presentation, I'm just going to give you a little bit of introduction and background. On June 1st, your board directed staff to bring back additional information on a few focus areas when we were discussing the initial topic of the ARPA funding. So one of those areas was broadband. So over the past few months, we've been in conversation with REACH, as well as the BCPC Econ Alliance, and various other stakeholders on participation in the broadband strategic plan countywide. So while we're not asking your board for any direct funding allocation at this time, we have identified that the broadband strategic plan is an eligible use for potential ARPA dollars. So we would like to explore the development of a countywide broadband strategic plan that'll help us leverage additional state and federal funding long-term for broadband. So with that, I'm going to turn it over to Bill Simmons, who is the project lead for the BCPC, to give you a presentation on what the development of a broadband strategy countywide would look like for Santa Barbara. So Bill, all you.
Welcome, Mr. Simmons. You're on mute, Mr. Simmons.
Thank you very much. And for a little bit of background, I might just introduce Melissa James from REACH, our partner who we've been working with in the preparation and planning of this presentation. Melissa, do you want to provide some opening comments?
Sure, I can be super brief. Thank you, Bill, and thank you, members of the board. It's great to be here with you this morning. I just was going to share a quick kind of contextual, update to the project that you're going to hear this morning. And I know it was probably back in the June timeframe when your board was considering, all of the ARPA funding that is coming in and ways to deploy it, those resources to invest in economic recovery. And one of the things that was really strong in what we heard from you all was really making sure that Santa Barbara County is positioned to be competitive, not just for the one-time funds that are coming into the county, but for the many funds that are out there at the state and federal level to invest in economic recovery. And so as you consider the project before you today, this has really been developed with that spirit in mind, how to position Santa Barbara County and the broader Central Coast region to be competitive for infrastructure investment related to broadband, being able to capture as much of the investment at the state and federal level to invest in kind of middle and last mile broadband deployment to support the economic recovery of the Central Coast, both for our individuals from a broadband equity standpoint, but also our businesses as well. So as we have come together as a region, the Broadband Consortium of the Pacific Coast, our umbrella organization, looking at broadband strategic planning and deployment for the Tri-Counties region, is proposing this project before you. But what we're really excited about is the partnership that has been cultivated over the last several weeks between the BCPC, the Econ Alliance, REACH, and then our partners in Ventura County from the EDC, as we think about ways to enhance the broadband deployment for Santa Barbara County, but also thinking about how to move forward in a larger regional context. So I think that is all I have to share this morning. I know that Bill's going to talk through the proposal and happy to join in the conversation as we move forward. So with that, I'll kick it back over to Bill Simmons.
Thank you, Melissa. I'm also joined by Maria Kelly from REACH, and she's a subject matter expert doing an awful lot of deep diving into funding sources, what legislation is happening, where it's happening, and what's happening. And so she is going to probably help me do cleanup at the back end of the next presentation of 12 minutes from now, all the things that I might have forgotten. Let's move on with the slides. First slide. If you don't mind going back, I want to Melissa introduced the organizations here. My comment to that slide is that you can't find a business license for the BCPC. You can't find a 501c3 designation for a consortium. I mean, the consortia is a virtual group. It's a collaboration. It's a group of organizations working together. The stakeholders are wide, broad, and large in terms of who are in consortia. We have municipalities, we have telecommunications companies, we have economic development groups, we have all kinds of folks. I mean, we literally have a database now with several hundred people that have been to our events, been part of it across the Tri-County area. We are very thankful for the County of Santa Barbara for the letters of support. We've been around since 2014, and we're funded by the California Public Utilities Commission. And we'll talk about this in the next couple slides. Our job is to help the California Public Utilities Commission bring into alignment the various counties throughout the state of California and their consortia across the state of California. And with that in mind, we as a consortia reach out to all the organizations. Our metrics is how much money is coming to the local area to take care of broadband projects. So getting ahead of myself, in this presentation, we'll pause a couple of times for questions and answers. I'm going to provide you a little bit of background about the consortium. We'll talk about the Tri-County area. We'll talk about the strategic planning process and the proposal before you. We're really very happy to be joined by the Chumash tribe as a real leader in terms of broadband in the northern Santa Barbara County area. And we'll talk about what they've been doing, and then we'll do a wrap up and summary. So next slide, please. A little bit of history about who we are. Next slide. I mentioned to you that there's a number of consortia across the state. We've gone through 2 different funding cycles now. There's other consortia that have gone through 3 funding cycles. Our Tri-County area of Ventura, Santa Barbara, and San Luis Obispo Party, we came online a little bit late in 2014. There had been a funding cycle ahead of us, but we've been playing catch up and doing a good job at it. And it's, as I indicated, that the Public Utilities Commission relies on us to help to find projects, opportunities, develop regional strategies for funding. Originally, CPUC was focusing us on the rural areas. Cuyama is a reoccurring topic of interest for Santa Barbara County. We've worked very hard in matching providers and seeking grants for the Cuyama area. The rural areas, if you will, we'll be talking about a middle mile network in the North County that we've been very much part of. But COVID changed everything. And as much as digital inclusion was important, it has become an imperative at this point. And all the lessons learned and the new funds that have been available in the last 18 or 24 months, there is a whole lot of getting ready that's going to be required for counties, all 3 counties, to work it together. And so this is the map of the state related to consortia, and we've got the Tri-County area here on the Central Coast. Next slide, please. Our planning model is convening, focus on infrastructure, the middle mile in particular, and then really look at how middle mile can be a catalyst for the last mile. And so we'll be talking about this, I'll come through it probably 2 or 3 different times in the next 6 or 8 minutes, but it bring the stakeholders together, those people that are talking, public and private and not-for-profit, as well as the social equity partners, and have a convening. You notice on the lower right, there's an AITR. That means all in the room. It's kind of a cultural meme that we're trying to embed into everything we do. We have to get everybody in the room. It has to be stakeholder driven. Everything has to be local as well. It's local within the county. It's local within each community. It's local because what our end goal, the mandate is internet for all. That's the whole purpose of broadband. And we have to we have to have all in the room to be able to get to that kind of solution. And so this is the model. We'll keep coming back to it as we go and talk about it further and talk about the strategy as well as what's been happening with the Chumash. Next slide, please. Okay, so let's talk about the state of broadband in the Tri-County area. Next slide. But before I do that, I have to tell you, broadband to a lot of people is a very complex issue, and you have to almost swim in this for a while to be able to understand all the terms. Cable, fiber, DSL, satellite, fixed, wireless, mobile broadband, 3 other terms. I would say long haul, middle mile, last mile, these are all part of the broadband lexicon. And, if you think about all of these pieces and parts, the answer is yes. They're all components of broadband. And it's the complexity of understanding this ecosystem, for lack of a better word, of how these pieces connect together in terms of broadband solutions for communities, that we're trying to help provide education and knowledge and those kinds of things. I want to also mention, based on one of the public comments that you had earlier today, we're as a consortium, as a movement for broadband, we're technology agnostic. It's what everything in terms of the conversation, what we all agree upon is the need for fiber. It really is about creating a fiber grid, about providing a fiber backbone. No matter what technology you're using, you're going to need to have the fiber connections for backhaul. And so backhaul is your long haul fiber. It's what goes from San Francisco to Los Angeles down the railroad tracks coming through the county. Then you have your middle mile. It's what is available to interconnect the communities. And how do you get up to Cuyama? I mean, you need a connection from down here in the region up the mountain. And then you have the last mile. How do you connect every home in the neighborhood? And so providing for those connections, having a conversation by which people understand the complexity of this and work for local solutions. This is where we're going, what we're trying to do, and what happens next. Next slide, please. Frankly, the state of California has been a little bit late to the party. If you look at communities like Chattanooga, St. Louis, Missouri, they're already Google communities. They have gigabit service to every home within a radius of 800 miles, if you will. I mean, it's a lot of other states are really have made significant investments in fiber. We're getting there. We got the memo, and COVID has been a real catalyst for that conversation. There is our first analysis of a report card was in 2016. This is a 2020 update. Not much has changed pre-COVID, but now everything has changed as we start talking about the funds that are available, the funds that the governor has signed, and working its way through Sacramento and the rulemaking that's underway. What happens is this is a good indication of business case. When you get into the highly dense areas, the LA Basin, the San Francisco Bay Area, you get better grades. If you get out into the more rural areas, the service goes down, and it's driven by density. It's just the way it is. And the report card itself is structured on two facets. Number one is capacity. That's speed, and that is the connectivity that's available at the speed at which is available at. But it's also governed by competition. If you have incumbents exclusively, and there may be only one telephone company and one cable provider, and there's no competition, that's a C. That's an average grade. And so if you get into some of the green areas, you'll have 3, 4, 5 competing telecoms, looking for service. And the best practices have shown that when multiple players come, when there's competition in the area, then you have quality of service increases as well as lower costs. And that is really the model that we're striving for. And that's hence the imperative as well for public participation, especially in those hard to reach areas. Don't want to spend a lot of time talking about the Wall Street Journal article about San Ynez Valley. It's just when this stuff hits the news, when it's not good news about broadband, it's just something to be aware of. Next slide, please. This data is about 3 months old. It's more accurate as well. And this is very interesting. We're focusing here on digital inclusion. Digital inclusion is not driven just by infrastructure and availability. It's also driven by people. And there's hard to reach, you'll see the dark red areas, which are unserved. You'll see the pink areas, which may be underserved. But there's certain, you get into certain populations and certain communities in certain areas and certain towns, and there's reasons why people don't subscribe. And we're going to have strategies using social equity partners, if you will, that are going to help target these areas and work to make sure that we can get all for internet for all. But it's going to take some very innovative strategies, very innovative collaboration, and some great partnerships with all in the room to be able to do this. And I think it rivals perhaps the Census 20 effort. Trusted agents, bridge builders, those kinds of civic entrepreneurs are going to be necessary to be able to reach into these communities and close these gaps of the last mile, if you will. Next slide. So we're going to switch gears and talk about a strategic planning process. Next slide. Purpose, stakeholders, regional context, timeline. You recall the slide we had where we were going to invite and talk about infrastructure and do inclusion. Well, this is where we really start examining through the invitations, people, priorities, plans, and participation. And so what's important about this as well is the timing. If you look at where the legislation is with SB 4, AB 14, the trailer bill SB 156, and the funds that are coming through Sacramento, it's going to be very important, my belief, that by the end of the state fiscal year, June 30th, that we know what we're going to do. We're shovel ready in terms of our willingness and desire to do it and ability to move forward. That's the timing and the urgency that we feel behind this. And so I also need to acknowledge Reach and its relationship with GoBiz. I think that they're trying to steer this through and get the results and the imperative communicated down while we're trying to reach up and how we come into alignment and what we do and communicate back and forth between the folks with the funding to bring to the area, as well as the confidence we can give them in terms of what the requirements are and the solutions required and the resources required. That's what's driving us in terms of the need for the strategy. Let me give you a further example as we go forward. Next slide. Resources. I'll tell you, 2014, when we started doing broadband up until COVID, there might have been 2 or 3 of these names on the list, but it is just in the last 18 months, the resources available, including the pending infrastructure bill from Washington, D.C., continue. As I indicated, we're funded through the California Advanced Services Fund, number 2 on the list. They have 2 kinds of money. Digital inclusion is being one of them in dealing with the people in the communities and the opportunities for partners to receive grant funding. And the other one is the infrastructure. We have worked very hard with Cuyama. Frontier as a telecom Frontier Communications has put forth a request for funding for fiber all the way from Santa Maria up the hill into Cuyama, and that request is pending, but it's taken time and energy. And as a consortia, it's our job to make sure those proposals go in and that funding is brought home. So that's just a little bit more example of what we do and what we're trying to do countywide. Next subject, next slide, please. I mentioned Catalyst. Let me tell you about the North County. Next slide. Chris Jurgwin has been a volunteer of ours, a visionary, if you will. He has a business in the Buellton area, and he came up with this vision on the right of a North County fiber ring. And then, once again, with all credit to Chris and the map, fiber rings, middle-mile networks are nothing new. This is something that is a best practice from a lot of other regions. We've just tailored it to the unique needs of the North County. About 18 months, 24 months ago, the Chumash had the opportunity to go for a broadband strategy grant. They did that. That grant was completed. The strategy was completed. And from that, this last week, the Chumash received an award from CSF for technical assistance on work that they're doing in the wireless area with 2.5 gigahertz band of wireless communications they're going to be providing the tribe, as well as pre-work to accelerate the picture on the right to be part of that North County fiber ring. They've also worked through their SEDS process for an EDA grant. That grant was submitted about a month ago, 6 weeks maybe. And in a similar way, yesterday we found out that Paso Robles had been recipient of an EDA grant. And so they've got a sizable portion of funding that are going to be going for the Paso Robles area. We're looking for every community, every region that possible that has access to the EDA funds to get those EDA funds for fiber development, build out, and design and engineering is really the key aspect the EDA can fund. And then more recently, the beginning of this month, the Chumash submitted a request to NTIA, sizable request for fiber coming down into the southern Santa Barbara County area connecting the reservation up in the north. And so having the redundant fiber from the north and the south is really imperative. And they're moving out in terms of putting critical arms, if you will, or tributaries of this ring in place. And what is really required is to take this kind of thinking, this kind of dialogue, and regionalize it. Not make this a pocket, but really make this a countywide initiative, a countywide conversation, and a countywide undertaking. And that's our proposal to you, is to just take this entrepreneurial spirit, this convening of stakeholders and the partners and municipalities that are all part of that, and move it forward and come up with a county posture, a posture for the entire county. Next slide, please.
Mr. Simmons?
Yes,
Let's
sir.
go back to that slide for just one moment.
Yes.
I just had a question about the Cuyama Valley and the leg, if you will, from 166. Is there any, would that terminate there, or is the vision that would continue on to Kern County and Maricopa and Taft and areas that are a little bit in close proximity?
I can send it to you. I believe it went on into Maricopa.
Okay.
I
guess the question was,
yes.
you might be more.
Yeah, I don't have the proposal in front of me, so I can't be. I know it comes down into Santa Maria, but I do recall that it makes a left turn and goes towards Kern County as well. So there is a way in on both sides.
Well, I see the value of having redundancy that goes north, south, and east. I was just curious on.
Yeah, I think it does. I'm pretty sure it does. Yeah.
If it was about redundancy, that makes sense. But if it's about, closer, fiber, it might be best to serve Cuyama Valley earlier with a partnership with some of the neighboring counties that might have urban, centers that are a little closer. Obviously we want to take care of our own in Cuyama, but just curious on how that would play in. But I guess we'll have those discussions over the coming months. Thank you.
Yes, sir. That's a great point. I mean, you're absolutely correct. A quick win would be perhaps to come in from the east. It's not such a long haul coming down the mountain way. Good point. Next slide, please. So what we're talking about, and this is conceptually because there's conversation, this is for you to discuss and for us to continue discussing and to move forward with that discussion, is coming up with a county investment, with the county not being alone, with municipalities as well as with business as well. And just from the Chumash activity alone, the $50,000 in the initial reservation strategy has resulted in that fiber ring discussion, with the NTIA proposal, the CSF proposal to Cuyama, which is Frontier's request of the state, is $12.5 million. The CAF-SF proposal that the Chumash just received this week, and then the EDA grant, you're looking at about 19 million that has been generated from that original start up in the north. And so we're looking to keep growing the snowball. The snowball is moving, and we're really looking to pick up some momentum in the conversations to follow. Next slide, please. So what we're asking more than anything is just to continue doing what we're doing. We had a presentation to the broadband group at SBCAG yesterday, and we felt like that was well received, and we're looking to be picking up momentum from that conversation. The consortium, as I indicated, we're not looking for a job here. We want to provide SBCAG the resources they need eventually to be able to look at virtual highways the same way they look at physical highways, provide governance and public sector oversight to these resources, and to really look at the processes required to do that. Our funding eventually goes away from CPUC, as we move on, as broadband becomes a fourth utility, or we morph into something else. But that's not a governance group. It's not a local group. It's just we're a resource group of collaborators. And what we've got to do is embed this as organic within the region that it serves. Every municipality should be talking about a community network that links anchor institutions. The county should be talking about middle mile networks that interlink the communities. And when it comes to public safety, wildfires, disasters and events, the redundancy required, the capacity required, those are conversations that are part and parcel to the broadband as a topic. So we're basically saying we want to continue to be a resource and a catalyst. At the same time, we're well aware that this has got to be part and parcel to the organizations that are our partners that make up the consortium. Santa Barbara County, at the county level, we're looking at leadership in developing the middle mile. When it comes to the jurisdictions, it's the conversations for the last mile in those neighborhoods that are underserved. The anchor institutions, they all want to interconnect. They all want to be able to do distance learning or public safety or whatever the technologies or the needs might be. The broadband infrastructure for libraries and hospitals is imperative. So that's what's next, is to continue doing what we've already started and then just widen the circle, if you will. Next slide, please. Our big wrap up before we go into questions and answers. Next. So we have measurable outcomes. We want a picture. If you look at the middle mile network for Ventura County, and it took 219,000. I looked at the contract today just to do the middle mile piece of creating a community network interconnecting cities. We now know what it looks like, where we need to do fiber builds. All of these funds are coming. We need to know what to be applying for, what is going to make it shovel ready. We know if you look at that map, imagining our region and the cities, you see certain lines that are red, blue, green, and yellow. Some exist today. Some need to be built. Some are underground. Some are over the ground as aerial fiber. And when you look at how these pieces come together and how they interconnect, they come up with, they represent projects. And those projects need to be moved and discussed and agreed upon and applied for, and funds come. And that's what the middle mile piece is. There's a whole nother part of the conversation that deals with the inclusion issues and opportunities and challenges that need to be worked on. But we know what the outcomes look like. We know what a strategy is. We know that there's this ticking clock in terms of the funds available, that we want to be ready for this. Why the consortium? Well, because we've been doing it, didn't see COVID coming. It sure has been an accelerant. It's like lighter fluid on the barbecue. It's changed the conversation dramatically. A mountain has literally been moved. And we're talking about something, it's what we've been talking about, but with a whole different set of knowledge behind us in terms of the need. So with that, I'm going to pause and say we're open for questions and answers. We look forward to your conversation and discussion. But before I do, Maria, there may be something that you wish I would have said. I value your input. Would invite you to say add anything else that I might have missed that you think is important.
Thanks, Bill. You did a fantastic job. I approve of it all, though. Just appreciate your time, and I look forward to answering any questions that the board may have.
All right. And just for the board's knowledge, we have Director Kern from SBCAG, as well as Ms. Bianchi Clement as well, that has been involved in this discussion. Supervisor Williams.
Well, I want to thank Supervisor Hartman for stepping up on this. I know the chair also has done so. There are definitely parts of my district that are not well served, Cuyama just being one of them. And so I'm very excited about this. This is a hot topic statewide. They're really it's revealing that addressing this, though it costs a big amount of money, it's a lot less than people really ever believed it would be. And so that does indicate an opportunity. I just wanted to understand those slides, the mapping on those slides seem to indicate places where there just was insufficient infrastructure, i.e. lack of service entirely. But I wanted to understand if the analysis is also inclusive of places where I suppose you could tell by price, or if you understood the infrastructure, where they're underserved, not that they're not served, but that they're underserved, i.e., there's not enough common carrier fiber to provide enough competition to have prices that are aligned with the rest of the state. Is your analysis inclusive of that? Because I do think that's part of the problem. We don't just get a D rating because there's some rural areas that are not served at all. My understanding is there's other issues.
Mr. Simmons?
The California Public Utilities Commission, the data that they've got available on the state website, and it was, I think we may have had one of those maps early on. That is data reported by the telecoms. They have a physical connection to a last mile residence, and it's served. The map that was there of NTIA with the red areas, if you will, that was, and I don't know, I'd have to do a deep dive into where the aggregation came from in terms of the data sources. But NTIA, the National Telecommunications and Information Administration, they have said that is the people factor. They may be served, but for one reason or another, they're not signing up. And there's reasons for that. You know, they're concerned about the cost. They may not be able to afford it. That they may not trust who the provider is. I mean, there's a multitude of reasons, and in the whole digital literacy issue is a complex issue, and that's where I don't pretend to have those answers. I'm aware of those people, and we're aware of those populations, and we know that they exist in every community, and we're going to have to find the right partners to work with, and that's where I draw the analogy of the Census 2020. Those hard to reach communities, we're going to have to find the right partners that are going to be able to help us with that same kind of fervency, to be able to connect them and put in place bridge builders and trusted agents to go and connect with them. So I don't know if I've answered your question, sir, but I certainly, the data is, we didn't have it 2 years ago. We're collecting it now. It's getting better, but we're going to, I think that it's not going to be done by the Sacramento or Washington, D.C. There's a part of what we're going to have to do locally, that we can, collect that data neighborhood by neighborhood in our communities by getting our communities engaged.
Thank you, Mr. Simmons. Supervisor Hartman?
Yes, your slide number 9 says 25% or more of American households don't have internet access. So that's a lot of people who aren't able to participate in school or businesses or communicate in other aspects. So that's a big number. I wanted to ask Director Kern if she would talk about yesterday's meeting and kind of the direction that SB CAG might be going in, and then I have some additional comments.
Director Kern?
Hello, this is Margie Kern from Santa Barbara County Association of Governments. And yes, we've had 2 meetings of our ad hoc committee from the Santa Barbara County Association's governing board. The second meeting, we did have Bill give the presentation just as he did to you today. So that was well received by our group. So the direction that I received from the group was to bring an item to the full board at their next meeting in October to discuss taking on a strategic plan for broadband, and to outreach to each of the jurisdictions, member jurisdictions of SB CAG, to help support that and participate in that effort. And with the help of PC, and move this along. So I think we are really excited about this. I think, like Bill said, COVID has brought this to everyone's attention of how much of a dire need it is in our region, and how necessity it is for our residents to participate in our everyday life. So this is a quality of life issue, a transportation issue, an air quality issue. It makes sense moving forward for SB CAG to be involved and engaged and make this happen. So I think I'm hopeful when it comes to the full board that we'll have that support, and then we'll take it from there. Thank you.
Oh, and I just wanted to add that in other areas like San Diego and LA, SBCAG equivalents are taking this on, so it's would be very appropriate. When we did have the ad hoc meeting yesterday, it seems like to get to a strategic plan, we need an organizational structure. We need to gather data. We need to develop project priorities from that data, where we have gaps, how we get a big picture for that. And then we can put together a strategic plan that will bring us funding. So, and the funding is available now, and people are looking for, shovel-ready projects. And so we need to get something together as soon as possible and then begin to develop it and refine it. It seems that the county's role is largely middle mile, and then although maybe it's in the unincorporated communities, it's some last mile. And then the incorporated cities, of course, are the last mile. I just think a lot of things have come together very quickly, and I do hope that we will step up and do our share. As Director Kern mentioned, the collaborative will be going and explaining this to other city jurisdictions and asking for their contributions so that we can move more quickly. And then this will come to the SBCAG board very soon. So I'm just encouraging my colleagues on the board to think carefully about this and how we might accommodate it when we discuss this in October for ARPA funding.
All right. Thank you, Supervisor Hartman. Other questions from the board before we go to the public? Supervisor Lavanino.
Thank you, Mr. Chair. So, great presentation, by the way, and for somebody that knows nothing about broadband. So this is very helpful. Question I have is, so I understand the consortium it's kind of identified as a virtual consortium. There's no real hard, fast 501c3 or whatever. And I'm curious, obviously that hasn't hindered you in the past from going after funding, but I'm kind of curious how that works for us. Would it be better for there to be, I don't know, it just seems different for us working with kind of a group that's not super identified. I mean, I like the approach, and I think it makes us more nimble, but how does that usually with funding, we're set up with people that maybe there's an identified structure, and it might not be the best way to do it, but that's what we've done in the past. And I'm just kind of curious how I just want to make sure this doesn't hinder us from being able to move forward and fund and all those types of things.
From a consortia standpoint, we are operating under the EDC, but with the funding from the California Public Utilities Commission, it comes to the EDC, and the partners get funded from the consortia. So the EDC is, I'd say it's an administrative partner, but what drives the consortia are the conversations at the partnership level and at the municipality level by the stakeholders. This is what collaboration is. And what we're really looking at in terms of our relationship with SBCAG is for you to get that real, we're not wanting to create a new mechanism. We want you to use the mechanisms that already exist for collaboration, especially on the public side. You already have a relationship with SBCAG. You rely on SBCAG to do certain things. We're wanting to work with them to diversify and expand the things that they do. We will, in terms of how we work and get funded by the CPUC, we'll continue to do what we do and rely and partner with SBCAG to do that. I will tell you, in the 3 times now that we've gotten funding from the California Public Utilities Commission, yes, the EDC in Ventura County is the one that puts the proposal together. I coordinate all of the technical content with the partners, and then I collect layers and layers, literally an inch full of letters of recommendation. And because you as supervisors, municipalities and mayors, industry and industry partners, as well as wineries and businesses and ag firms, I mean, you name it, I can show you the letters and the quotes. That's what the CPUC values us for, is the broad cross-sector interest of all of the local folks in the region. in those organizations. And that's why we get CPUC funding is we have demonstrated we're a group of cross-sector interests on behalf of the region. It's not us versus they or we. It's together. We are you. I mean, that's what we offer, what we provide.
Miyasato.
Supervisor Lavanino through the chair. It's a good question. I just asked Nancy Anderson that should the board decide to give ARPA funds, and we meet in October, I think the request is 200,000 of the 300,000 for the study. I just asked her, are there any complications technically of the ARPA dollars of giving it to the consortium versus SBCAG versus us doing some part of that?
Good morning, members of the board. So this project for specifically the strategic plan is what we're understanding is really the first step of what we need to get access to other funding, to have those conversations start from these other groups, similar to like Chumash and where you're moving it through a multi-faceted project. So the project just for the strategic plan has been reviewed by the auditor controller. So it's a verified eligible project to get started for using ARPA funds for potentially a broader project. It's great to hear that SBCAG, who is, that's their infrastructure related. And ultimately we would see that if the board is interested in having these other opportunities for funding, because you could go to a full-blown project if that's what the board wanted to do with ARPA funding. But the intent is as Bill has eloquently indicated as part of his presentation, is the collaboration between all of the entities that could bring multiple funding sources together. GOBAs is involved. If we get state and local agencies that can pool these resources, and then have SBCAG is like great to hear that they're kind of taking a lead thought process in this in order to help figure out what that end result in construction and those types of things will be. But for the strategic plan, we need that in order to find the gaps that that are countywide for our county, as a starting point in order to identify those areas.
So Ms. Anderson, there's no technical reason, that's what I'm trying to get at, for the ARPA dollars and how they're the requirements for the county to give it to either the consortium or another governmental agency.
Now, essentially that what we would be paying for is the services to provide a strategic plan, which is what we need in our hands. So you're paying for a service, and that is legitimate.
Perfect.
Okay. That's what I wanted to know.
Thank you, Ms. Anderson. Thank you, Supervisor Lavanino. Supervisor Williams and Supervisor Hart.
So I know that our decisions about these funds are going to be very difficult. There's a lot of requests, a lot of needs out there. This is going to be kind of brutal. But in this case, the immediate need in this year's round of funding would just be the study. Is that true? And then any further need for capital funds, we potentially could use the next round, and therefore it doesn't have to be part of the Hunger Games competition for this round of funding. And am I getting that right?
Supervisor Williams, through the chair, I'll respond to that. You are correct. The intent of this, the actual strategic plan that they would be developing, is not only access to ARPA funds. It could be that ARPA funds aren't even the infrastructure component. There are so many other funds, as he indicated, that are available, but you need the strategic plan to make it happen. So,
great. Thank you, Supervisor Williams. And thank you, Ms. Anderson. Supervisor Hart.
I understand the relationship of the strategic plan to future grant competitiveness. But just so I understand where we are now, the slide 15 that describes the North County initiatives that are awarded and proposed, which ones are awarded and which ones are proposed? It appears like there's about $6.5 million aimed at the Chumash plan, which they get tremendous credit for leading the way on doing that advanced work. And then another $12.5 million to serve Cuyama. Are some of those granted by geography for the Chumash, for example, and the other one hoped for with Cuyama?
We have two of those have been awarded. The first IEED, the 50K, the CSF, the 90K. The EDA one, you know, how EDA works, that those conversations have been gone in the tailored, customized approach that EDA is counsel to is well underway. We don't see any hiccups. We're not getting any negative feedback from EDA. We're pretty confident that those will be coming. The NTIA one, the deadline for submittal of that was the early part of September, and that's the $6 million. And then the CASF one with Cuyama, that's the California Advanced Services Fund from the California Public Utilities Commission. It's still in the hunt. We had an email out that had it listed in this last week in terms of what they were still trying to process. What is happening up there right now is a bit of rulemaking. The CPUC is looking at the new legislation. They're looking at what they have in the pipeline. They're trying to figure out the new rulemaking processes that will occur. It seems to be slowing things down, which probably is to be expected. But those are all still active, and I'm believing that with a high level of confidence, there's a good chance in getting the trifecta.
I appreciate your level of confidence. That's exciting and great. With the $6 million Chumash grant and the $12.5 million Cuyama grant, is that for actually laying fiber, or is that for more planning?
Design and engineering and laying. It is a fiber delivery in those cases. And I want to stress the point of collaboration. As much as the Chumash are applying for this, they're doing it under the auspices of this North County Fiber Ring. And the vision of the ring is this is municipal owned. This is in the communities themselves will own fiber. In terms of the interconnects in the middle mile, whoever is applying for the funds will own the fiber. But it's going to be open access where multiple providers can get to the same point using the same fiber. What the region needs is this, perhaps eventually through the SBCAG, joint powers where you really do have open access fiber availability to all of these communities. So it's different partners are going to be asking for different monies, but it'll result in this patchwork quilt map of shared fiber resources, public and private.
And then maybe just to take this one more step so I understand the pieces better. If I'm looking at the map on slide 14, the $6 million request and the $12 million request to actually do engineering and lay fiber, what length of those lines on the map would that fund?
The one funds from the NTIA funds from the reservation down the backside into Goleta. So okay. It's the middle link, if you will. The one from Cuyama is funding the upper link of that map.
From Santa Maria out to Cuyama.
Yes.
Okay, thank you.
All right. And I believe we actually have for public comment, we have Sam Cohen from Chumash Tribe. So that's, Madam Clerk, can we go to public comment at this time?
Yes, Chair Nelson and members of the board, we have 2 requests to speak on this item. We are going to begin on Zoom with Sam Cohen, and then we will be going to Santa Barbara for Katie Mickey.
Okay, and I'm go ahead and close public comment on this item and go to Mr. Cohen.
Good morning, Chair Nelson and member of the boards. Can you hear me?
We can.
Excellent. It is a rare but joyous occasion when the Chumash tribe can lead the county down the road for broadband development. We ended up doing a feasibility study for the lack of broadband service, well, actually in all of the San Ynez Valley, and especially for the reservation, which grew into an EDA grant that we partnered with the Econ Alliance working on for about 2 years, which was recently filed for a study for the north part of the county. And then along the way, the NTIA had a special tribal only grant fund that had a September 1st deadline. So we were rushing like crazy people to do enough planning to get at least $6 million to explore 2 routes, one up Highway 101 through Buellton and eastward to the reservation, and the other one up Highway 154 to the reservation, which would be your southernmost link of the broadband ring. And then along the way, the CPUC gave the tribe a little extra money. We were fortunate enough to get awarded by the FCC the 2.5 gigahertz bandwidth over the reservation and connecting all the way to Camp 4, which is the educational bandwidth. And we need to actually get 80% coverage over tribal lands and even the community of San Ynez in the next 5 years. So the CPUC money will go a long way towards that. We're happy to be a test case. We've developed a lot of survey instruments that we're going to contribute to this project, and we look forward to partnering with the Broadband Consortium and REACH and the County of Santa Barbara. Thank you.
Thank you, Mr. Cohen.
We will now go to Santa Barbara for our final speaker, Katie Mickey.
Thank you for your presentation, Mr. Sims. I am representative of Safe Technology for Santa Barbara County. And what you described, the rollout of fiber for the long haul, middle haul, and last mile, all sounds wonderful. And I would seek clarification. Can you clarify if this project involves fiber for all three hauls, or does it include some small cell wireless antennas for the last haul? With our state ablaze with wildfires, I just want to express the concern that having increase in small cell wireless antennas in our rural areas, if that is part of the whole broadband project, increases the potential for wildfires because the small cells are combustible and they increase the terpenes in our forests, our trees, and make the trees more combustible. And it also has a great increase in energy consumption, which will contribute to greenhouse gases. So I want to add a note of caution with all the wonderful description of getting internet out to people in all areas. I'm certainly an advocate that it is fiber optics all the way to the premises rather than small cell wireless antennas at the last leg. So I'd appreciate your clarification on your proposal. Thank you.
Thank you, Ms. McBee.
And that was our final speaker.
Okay, back to the board and staff. Any additional comments from staff at this time?
No further comments, Chair Nelson. Just happy to answer any further questions. As indicated, the ARPA discussion will happen in October 19th, and the board will be hearing other ARPA workshop presentations on October 5th. So more to come on that.
And just to confirm, the $200,000 ask from the county will be out of the categorical funds and not necessarily the discretionary funds that are available.
They're eligible for ARPA funds, so we would call it, as we call it, restricted. It would be
Restricted.
out of that.
Mhm. Okay, thank you. Supervisor Hartman, please.
I just had a technical question. Are the larger cities in our county already well served? Or would they want to participate in this?
That question to me?
Yes, please.
Yes, you know the most about it.
Just checking. Yes, and yes. I think it is the answers to your two questions. They are already served, and yet I think that even with the partners that we have and the conversations we have, there's recognition that there's portions of those cities that may be underserved or unserved. And so we've started off with maps in conversations over the years with them where we do look for gaps in where there is no physical infrastructure. And a big part of this is also then going to be looking at areas that are served, but for one reason or another, the inclusion aspect, they're not being used. And so there's a digital divide that is more of a people problem than an infrastructure problem. And so, we really do, our goal is internet for all. It's going to be 100% solution. It will be the fourth utility, in terms of the vision that we seek. And it'll be as integral to every dwelling, every family, every business as water, gas, electricity. So that's where we're wanting. That's our vision. That's our mandate.
Right. Thank you, Mr. Simmons. Thank you, Supervisor Hartman. And I just want to take an opportunity just to thank all the people in the community that have been working towards this. Many of them saw this coming years in advance. Obviously, Mr. Simmons, but Econ Alliance and Vicki Connors, thank you for all the work you've been doing in this space. And of course, the Chumash Tribe. And then, a new partner to the county is the team at Reach, Melissa and company. And this is going to have a great tie-in eventually with Vandenberg Space Force Base as that continues to progress, and having fiber available for them and their vendors and their contractors is going to be an essential part of developing that future industry. So I'm really excited about this and look forward to supporting this in our ARPA discussions in the coming weeks. So with that, can I get a motion from someone on the board to receive and file?
I'll make that motion.
Second.
All right. And just to clarify, that's recommended actions A through C? Yes, sir. All right. All in favor signify by saying aye. Aye.
Aye.
Motion passes unanimously. All right, we're going to take a 10-minute break, and then we'll be back to hear departmental item number 3. And then we'll be breaking for closed session and coming back after closed session to hear item number 4. Thank you. All right, welcome back. Okay, this time we'll hear departmental item number 3. Madam Clerk, will you please read it into the record?
Chair Nelson and members of the board, departmental item number 3 is from Behavioral Wellness. It is a hearing to consider recommendations regarding the Santa Barbara County Department of Behavioral Wellness, Capital Housing, and Care Continuum.
Sorry, I believe we have Ms. Fisher with us.
Yes, good morning.
Welcome. Welcome.
So good morning, Chair Nelson and members of the board. So I'm here today with my division manager, Laura Zeitz, and she is a subject matter expert in housing as well as our inpatient facility. She's a division manager with our department. And we're here today to present an update on our department's capital housing continuum, as well as our priorities for future projects to serve those receiving specialty mental health services and substance use disorder recovery services. For today's presentation, we'll be discussing the types of facilities that are within our behavioral wellness continuum of care that are used by the clients we serve. And for ease of this presentation, we have organized our services along a continuum from the most restrictive and costly to the least restrictive and costly. Go ahead and advance the slide. Go ahead and advance the slide. So as you can see, the first setting along this continuum and the most restrictive is our acute setting. And these are for individuals with the highest level of acuity. And these are facilities that need medical and nursing support for patients. And they include our psychiatric hospitals, such as our inpatient PUF, our psychiatric hospital facility, as well as other contracted hospitals. Go ahead and advance. The next level of acuity is our crisis facilities. And these are facilities that also need some medical and nursing attention with our clients, but they provide a shorter length of stay, typically include our crisis stabilization units, which are a typical 23-hour stay, or our crisis residential treatment facilities that on average have a 30-day average stay. The next level is our residential settings, and this encompasses a broad range of facilities that offer different service level intensities. An example of these are facilities that range from out-of-county placements that aren't currently available within our county, such as Synergy's unlocked mental health rehab centers, to our local in-county residential treatment programs, such as Phoenix or Mountain House, to some smaller facilities that we have in county that provide on-site support, such as Alameda House. And then finally, in the continuum, we have permanent supportive housing, which are housing with lower service intensity levels that provide support services to help people live independently and typically provide some case management services. Next slide. So this slide shows the average cost per client per night of each type of facility along our continuum. And as you can see, the most costly is inpatient services at a cost of a little over $2,500 per night. And the least costly is our supportive housing, which is costs an average of about $15 per night, and everything in between. Okay, stay on this slide, but it's really important to note that any gaps or insufficiencies along our continuum of care from a facility or program perspective can result in an overuse of a higher level of care or a crisis situation due to the lack of the proper resource that matches the appropriate need for the client. So either scenario really results in a poor outcome and a higher cost to our system, but also fails to meet the recovery model standard that we've adopted through systems change, which is to serve each client in the least restrictive setting that's appropriate for the client. Okay, next slide. Next slide. So this slide depicts the goals from the capital facilities that were developed from a community stakeholder process, as well as our HEART team, which is a housing action team, back in 2016, in which, and the facility types along our continuum. And the goals that they had set back in 2016. And I'll discuss each of them in more detail as we go along the presentation. This is just a snapshot of all of it. So go ahead and next slide. So as you can see, in 2016, our acute capacity was 16 beds and our detox capacity within county was 0. Next slide. And today, although we still have 16 beds at our acute level, we've seen that over the past 5 years that we need to contract on average an additional 7 beds per day. We've been able to recently mitigate some of these additional beds by adding 2 pilot misdemeanor incompetent to stand trial beds at our Crestwood facility, which is a locked MHRC, mental health rehab center. So whereas in the past, where individuals would have been previously sent to the PUF to either await a conservatorship or restoration within a locked facility because there was no other choice, we can now send them to an in-county locked MHRC, which is Crestwood, which helps ease the burden and the need of additional PUF beds in county. And another recent mitigation factor, which you'll see later in this presentation, was the development of additional beds within our crisis system. And we haven't been able to see the outcome of that yet, but we have recently contracted for 2 beds at Marion, which is a locked crisis stabilization unit. And research shows there that 70+% of people going to a crisis stabilization unit don't actually need an inpatient bed. So we will monitor that and see what the outcome of that is. And then finally, you can see that in 2021, we do have 17 detox beds averaging per day in the county, although we do have contract ability up to 34 beds per day. Go ahead and advance the slide. In 2016, you can see that our identified need for in-county crisis stabilization beds was 8. Crisis residential beds was 12. We identified a need and identified a need of 50 shelter beds. Advance. And then today, with the addition of the 2 beds I just spoke of at Marion, we will be at 10 crisis stabilization beds in county. We have 32 crisis residential beds in county, and today we have 49 emergency shelter beds. Go ahead. In 2016, our residential capacity for mental health rehabilitation beds was 0. Our adult residential board and care beds in 2016, we started at 52 beds, and our alcohol and drug residential beds, although it says 0, but we really did have a few, very few specialized perinatal beds, but no other residential beds. And then advance the slide. And then today, our mental health rehabilitation beds in county are 34. Adult residential board and care beds, we have 74, and we are averaging per day 38 beds in residential alcohol and drug, although again, we have capacity to contract up to 90 if we need them. Go ahead and advance. In 2016, we identified that we had 54 units in county, and these were MHSA funded housing units. And today we have 122 units with another 33 that are in development. This slide depicts a summary of the growth from 2016, as well as our department's remaining need, and a brief description on how we were able to fund the development of our facilities to date. So as you can see, under the acute setting, we believe that we've attained or have the ability to attain our goals by shoring up our lower level crisis continuum, contracting with other hospitals for out-of-county inpatient needs, and we have met our detox needs. Under the crisis realm, we've exceeded our goals in most areas, and this was achieved by grants from the California Health Facility Finance Authority, which provided us funding to build and renovate facilities for this purpose. Next. Under the residential facility, although we've been able to successfully add numerous beds, we still have a way to go in this area. Identifying a need of 16 additional mental health rehab center beds and 26 additional adult residential center and board and care beds. Our ability to add beds in county to date has been really due to the ability to move individuals from out of county placements back to in county placements and bring the funding that was with them out of county back in county. We also use the generous startup funding that the board gave us within the last 5 years, and we've used Medi-Cal for expansion. And finally, under supportive housing, although we've added 122 beds with another 33 in development, primarily through Home Key, No Place Like Home, and MHSA, we still identify a need of 85 beds throughout the county. Next. So this is a map of our service locations throughout the county. And the next slide. And this is the same map with the overlay of the facility types I've just described within each location. So each dot represents a facility type. So the red is the acute, and you can see in each region where there's an acute facility. The orange represents a crisis facility, the yellow a residential facility, and the green a supported living facility. Next slide.
So Ms. Fisher, can we go back to that slide for just a second?
Yep, go ahead.
So there are no facilities in Guadalupe, Buellton, or Solving. Is that what I'm seeing here? Just
there are not.
Okay, all right. But those areas are served through those assets that we have in those other cities.
Yes, that's correct.
All right, thank you.
So going forward, these are our department priorities. So under the residential realm, we've recently secured 2 additional beds at Champions, which I spoke of earlier. And these are for clients that have misdemeanor offenses. And we hope to see them take some of the heat off the puff and be able to open up some of our puff beds. And the goal is to secure an additional 16 mental health rehab center beds with at least 6 that are designated for conservatorship folks that are stepping down from the state hospital. Next slide. We also want to identify opportunities with community partners for developing additional board and care and residential treatment beds. And we do want to focus on some medical fragile folks in the aging population because we know we're all getting there and we have a higher number of them in our county. We want to explore MHSA and grant funding to support development of an unlocked MHRC. There's greater funding for unlocked MHRCs and facilities that are less than 16 beds. So we want to look at that. And we want to be able to support clients transitioning from locked facilities into an unlocked facility as just one more part of the continuum to help them transfer back into the community. And we also want to continue to explore youth placements using grant and short-term residential treatment placement funding. And we also want to complete the development of our No Place Like Home funded projects and explore and secure additional Home Key projects. Next slide. These are some photos of what we have developed throughout the past 5 years. This is a photo of the inside of our crisis stabilization unit in South County. And these are, it has just an open room. And these are chairs, but they do fold into beds. So somebody can go in there and then they can put the bed out and just lay down. And then there's also 2 rooms that the doors close and they can have quiet space in that facility. Next slide. This is a photo of our crisis residential center up in Santa Maria, and it did win a design award. And again, you can see the outside area as well as some inside area of this facility. Next slide. This is a photo of the mental health rehab center in Lompoc. We call it the Champion Center. This is a locked facility, more long-term placement. And this is a photo of Depot Street, and this provides supported housing, independent living for individuals. And this is a photo of our Depot Street. This is not Depot Street. This is
Lompoc.
No,
Lompoc.
yeah, that is Lompoc. That is
Yeah.
the home. That's the
Home
famous
Key.
Home Key project.
Yeah, Home Key. But it's not called Depot. What's it called?
We call it the studios.
Studios. Okay. I recognize it's Lompoc because it's where our offices used to be. So this is where our clinic used to be in Lompoc, and it was sold and then remodeled via Home Key. And it was for homeless individuals and at-risk homeless individuals for rapid housing for them. And that concludes our presentation, and we are available for any questions you might have.
All right. Thank you, Ms. Fisher. Ms. Seiss. Supervisor Hartman.
Well, I think this is just an extraordinary presentation, both the progress that we've made and just how clearly, concisely it's laid out, where we've been, where we are, and where we need to go. I was struck in the board letter that in our jail, 150 to 250 people are there because or with mental health problems, sometimes very complex. And so the conclusion I draw from that is that this is where we really want to invest if we want to keep the jail population lower and treat people in a more appropriate setting for their needs. And so I guess my question is, do these projects qualify for ARPA funding? And that may be a CEO question rather than a
we
behavioral
hope
wellness
so.
director. I mean,
Yeah,
is that
we would be
partly what
delighted
we're
if they were.
debating or considering here today?
Supervisors. So a couple of things. I think there's many that probably would, but a lot of these are ongoing costs. And I think that has been the challenge for the department, for the county, is figuring out the ongoing cost, the ongoing revenue to support these beds. Otherwise, we would do a lot more than we could. We're always constrained by costs. And the department has a Mental Health Services Act funding. There's lots of other pots of funding, but those are committed to other things. And I think the department does an excellent job of trying to figure out what's the highest priorities, what's the Medi-Cal match, all those things as we go forward. So the plan that we're going to bring to you, I think on October 5th, which is a Health and Human Services plan, it includes other types of needs that have been identified to serve to serve the community regarding mental health. I don't believe we have these types of housing units and support except for the supportive housing for homeless. We can talk about that when we come to the board, or if you have requests that we include more, we can. But the requests, as you know, are about twice as much as the funding. And we're trying to, for that plan, and I don't want to talk too much about it because we're really here talking about the capital facilities for mental health. For that plan, we are trying to look at interventions that would make the most significant impact over the next 3 years to tie it with the ARPA funding.
Thank you. Again, I think it's an extraordinary accomplishment.
All right. Thank you. Supervisor Hart, Williams, then Lavanino.
Yeah, like Supervisor Hartman, I just want to say thank you for a great presentation, and it's very inspiring, encouraging to see the progress that's been made in a relatively short period of time. With a focused plan, persistence and creativity, really extraordinary things can be accomplished. And the first thing that pops into my mind is, what is the next increment of planning going forward? And what would you be looking to achieve in the next 5 years or whatever that increment is?
I'm gonna ask Laura to answer that because she facilitates our HEART meeting, and they're the ones who kind of set the agenda for housing going forward. So, Laura?
Chair Nelson, Supervisor Hart. Yes, we are looking at several different innovative programs. Pam mentioned one of them. It's an unlocked mental health rehab center, provides a step down from the Champion Center level of care. We do need to develop and do some more evaluating as far as our forensic population. There's a lot of changes that are happening at the state level regarding state hospitals, restoration for felonies. And as a good community partner, we want to look at that long term to see where we can have a positive impact. We're also tracking funds that are coming through the state for that perhaps could help us shore up the board and care and adult residential level of care. That's something that we have a meeting every week in the North and South County, and the queue for those beds is quite long. And if we had more of those type of facilities with Medi-Cal billing to sustain them long term, I'm certain we could fill more of those beds. So we'll be looking at that as well.
Well, thank you, Laura. Like I said, having a plan and having benchmarks for each of these categories going forward in time is a really great way to measure progress. Have it be data driven, and I think it gets the board's attention too. That investing in projects that happen, encourages more investment. So I just want to applaud the department for putting this together and sharing this with us and the public, and it's really a good news story. So thank you.
All right, thank you, Supervisor Hart. Supervisor Williams and Lavanito.
Well, I'm glad that Laura mentioned that, because I do think that there are state streams of funding that we also have to think about this at the same time, right? And I know that's difficult because in some of those streams of funding, for instance, for permanent supportive housing, there's a couple sources that's coming from the state that are possible sources as well. We've got to figure out if we can use those. Hopefully, by the time we have a decision point of whether or not to use ARPA for it, because to maximize the impact that we could make in addressing homelessness and in addressing our mental health challenged population, of course, of which there's a significant overlap between those two groups.
Thank you, Supervisor Williams. Supervisor Lavanito, and back to Supervisor Hartman.
Thank you, Mr. Chair. I wanted to, I think we probably can't have this discussion today, or we shouldn't, without recognizing Dr. Gleghorn. When Alice first got here, she was probably a little frustrated and shocked of the lack of facilities and the lack of range of what was available for treatment out there when she got here. And one of the things that I think everybody should look at, whether it's, even for the most, I don't want to say conservative because that's the wrong term, but for those that, I think you can look at this a number of different ways. And one of them is, if you're just looking at it from a hawkish budget perspective, that this actually saves us money, having more facilities, more capabilities, because when you don't have those, you end up treating people at the highest level of care, which is, as we saw from this report, can be extremely expensive. I think the other thing is here in Santa Maria, bringing both Depot and the Agnes facilities brought much needed services to Santa Maria. And I also want to thank the citizens of the city of Santa Maria, especially those ones that live around these facilities, is that these are historically difficult to site. And as a testament to them, and I think how they viewed these facilities more as much needed community improvements than intrusion into their neighborhoods, I did not get phone calls of people just up in arms over the fact that the county was jamming these facilities into their neighborhoods. So really appreciate that and all the hard work. And I have to say also, those from NAMI that continue to hold our collective feet to the fire in the departments. And as Mona has said, this really comes down to the need is always going to be there. It's how do we afford this, and how do we best position ourselves, as Supervisor Williams said, with different streams of money, and making sure that we're being the most efficient as we possibly can.
Thank you for this comment, Supervisor Lavanito. Supervisor Hartman.
A question that I often get from people is about youth placement, and you said that we're looking at various grant opportunities, but I wonder if you could talk a little bit more, elaborate, and how could we make that a higher priority?
Thank you, Supervisor Hartman, through the chair. So when we go, if you want to go back to that slide talking about STRTPs, I don't know what slide it was, but when we were, excuse me, when we were looking at STRTPs back in 2016, there was no such thing as an STRTP. What we had in county were group homes. And in our county, we had group homes that were from a level, I think, 8 or 10 to a 12. And then the county, through the continuum of care reform, changed everything. And we no longer had group homes here, and we had to go to short-term residential treatment programs. And what they did in doing so was they offered a higher level of mental health treatment in the group homes. So while the stay in these group homes, these short-term residential treatment programs, have to be shorter, no longer is the child going into a short-term residential treatment program for 2 years, which they used to stay in group homes for a long time like that. Now they are in these short-term residential treatment programs for about 6 months. But there's an intensive amount of mental health treatment provided within the group homes. So these group homes or short-term residentials have their own mental health providers. They have their own psychiatry, case managers, therapists, et cetera. So we have 2 right now in county, and our department has helped support them as they get up and running. And we actually go out and provide the psychiatry and the therapy as they're getting licensed, because there's a lot of hoops they have to jump through to get licensed now, since they have changed to a short-term residential treatment model. And I think there's one more right now on the horizon that we're supporting getting developed. But there is funding through Medi-Cal for these programs, and we contract with them for their services. So we are supporting them in that manner.
Thank you, Ms. Fisher, and thank you, Supervisor Hartman. Before I go to Supervisor Williams, I understand Ms. Zeitz has her hand raised.
I just, Chair Nelson, Supervisors, I just wanted to say that although this is a huge accomplishment, we have a long way to go, but none of this would have been done without Pam's leadership, the leadership of Dr. Gleghorn, our partnerships with our community-based organizations, including even county departments like HCD, the Housing Authority, and really the stakeholder input from the community and the HEART team, some of the stalwart people that have been there 5 years pushing us hard in the right direction. And so I just wanted to acknowledge, and our internal team, contracts, Lindsay Walter, Natalia Rossi, Evie, all of us, thankfully, because of Dr. Gleghorn had a dedicated team to make this happen. And without those things in place, you wouldn't see these achievements. So I just wanted to acknowledge that.
And thank you for that acknowledgement. Supervisor Williams.
Well, I think it's clear that there are parts of our continuum of care that need to be expanded. And this was a really helpful presentation in seeing where the areas of greatest need in that continuum are. And of course, I've seen time and time again, people who don't end up in permanent supportive housing or in, some of these other facilities eventually finding their way to the PUF. So I think the logic of the department's priorities for expanding the continuum of care are make a whole lot of sense. But of course, we'll never know until we actually build it all. So that we've got to take advantage of the time and the moment. And despite the many requests, find a way to use this moment to expand that continuum of care.
Thank you for that, Supervisor Williams. Let's go ahead and move to public comment. I believe we have a couple of speakers, Madam Clerk.
Chair Nelson and members of the board, yes, we have 2 requests to speak on this item. And we will go to Zoom for Suzanne Jordan, to be followed by Lynn Gibbs.
Okay, let's go to Suzanne. And then at this time, we'll also close public comment on this item.
Good morning, Supervisors and Chair. Can you hear me?
We can.
Wonderful. So I'm Suzanne Reardon, and I'm speaking on behalf of Families Act. And Families Act is a local grassroots organization that was formed 15 years ago in Santa Barbara. And our members have been advocating tirelessly ever since, in particular for mental health treatment beds. In fact, one of our mottos is beds, not cells. So we're very concerned, and we always have been, about people with mental health conditions who end up in the jail when they belong in a treatment center. And kudos for the considerable progress that has been made since 2016 in our capital needs for mental health facilities. We are incredibly proud of the county and of the Be Well Department, and particular of Laura Zeitz. But we will also take a fair amount of the credit for the blood, sweat, and tears and innumerable meetings that went into convincing this county and our mental health department about the needs for beds. Despite all of our efforts, however, the need remains pretty substantial. There have been many tragic deaths, even over the last 4 years in our county for lack of adequate inpatient beds, for example. And unfortunately, even though our philosophy, the county's philosophy now is that we should put a lot of effort into the lower levels of care to prevent the need for the higher levels of care, the reality remains that the highest level of care is still required and that we will lose people if we don't provide them. Even though that level is expensive, we're particularly concerned for the need for beds, inpatient acute beds. And recent data from Cottage Hospital's emergency department revealed that in August, 11 patients who were in an acute mental health crisis and placed on a 5150 walked out before they were ever placed in a bed. In other words, they stayed the length of time they were required to stay, but no inpatient bed was found for them. The presentation that we just saw is a bit misleading in terms of how many acute inpatient beds we've added to our continuum since 2016, because it fails to indicate how many such beds were contracted for in 2016. The beds we contracted for with facilities such as Vista Del Mar in Ventura County are not represented. So we haven't really increased the number of beds since 2016 in that category, as far as we see it. It's generally agreed that a community needs 40 acute inpatient beds per 100,000 residents. But even if you used a much, much lower percentage, let's say 10 beds per 100,000 residents, this is 10 acute inpatient beds. That would be about 40 inpatient beds, and our county currently only has, let's say, 26 with the contracted beds. So there's room for improvement. The other area we're very concerned about is congregate living, unlocked residential treatment beds, something along the lines of the Synergy program that we send people to in North County, in the northern parts of the state, north of here, and something like Phoenix House. We need more state-of-the-art beds in that category.
Thank you, Ms. Reardon. Thank you for your comments.
And thank you very much.
All right. Our next speaker is Lynn Gibbs.
Yes, Chair Nelson and members of the board. Our next speaker is Lynn Gibbs, who is our final speaker.
All right, jump the gun. Welcome, Ms. Gibbs.
Thank you. I chair the NAMI Santa Barbara County Public Policy Committee, and we've been tracking the 5150 inpatient bed crisis with our community hospitals, where people are initially placed on a 5150 waiting for a bed placement. And there continue to be a large number of cases where people are unable to get the treatment bed that they need. It's truly remarkable, we think, what's been accomplished over the past 5 years in addressing the continuum of care. And that the construct that was laid out by behavioral wellness of the continuum of care is something that's now being looked at by other counties. I know Ventura County is looking at it. It's a very good way to say, okay, here's what's needed at various levels, and we've made good progress. And this is why in NAMI, we emphasize the need for fuller utilization of crisis stabilization units that can divert a number of people from needing an inpatient bed, and for Laura's Law, so that people, when they're leaving the hospital and still unstabilized, can get community-based treatment that we know reduces a recurrence of the need for inpatient beds. Nevertheless, we could draw an analogy to someone having a heart attack and going to the ER. At that point, we don't send them home with a heart healthy diet and prescription for a statin. It doesn't work at that point. And we see the same problem with people in the emergency rooms. And so we really urge a focus on this shortage of beds that people need in the most acute crisis with the most severe illness, and working with our community partners and the hospital to address the need that we have for more beds. Thank you.
Thank you, Ms. Gibbs. Now back to the board. Any further comments from staff? All right, not see any. Questions from the board or comments? All right, at this time, I'll take a motion. I believe it's to receive and file. I think those are items A through C. And A through B. Can I get a motion?
So moved.
Second. All right, any further discussion? All in favor signify by saying aye.
Aye.
Motion passes unanimously. Okay, at this time, we're going to break for closed session. Madam County Counsel, will you please read the items for consideration today?
Thank you, Mr. Chair. We have 3 items on for closed session today. The first is existing litigation under Government Code Section 54956.9, and that's Casablanca Beach Estates Owners Association versus the county. Second is anticipated litigation, significant exposure, civil litigation, 1 case under Government Code Section 54956.9. And finally, conference with real property negotiators with assessors parcel numbers 105-020-063 and 105-020-064 between South Point Estates and Clark Avenue, Old Town Orchid. Agency negotiator Jeanette Pell and negotiating party Michelle Southwick. And also assessor parcels numbers 105-020-060 between South Point Estate and Clark Avenue, agency negotiator Jeanette Pell and negotiating parties Leonard Knight and Matthew Knight. And the time estimate is 1 hour and 15 minutes.
Okay, let's plan on being back from closed session at 1:30 to hear our fourth and final item, departmental item number 4. Thank you. Okay, welcome back. We are now reconvening the meeting of September 21st, 2021. Will County Council please report out from closed session?
Thank you, Mr. Chair. The board met in closed session on 3 items. The first, existing litigation, Casablanca Beach Estate Owners Association versus County of Santa Barbara. The second item was anticipated litigation, significant exposure to civil litigation, 1 case. And the third was real property negotiations for 3 different parcels, all of which were in Old Town Orchid, Clark Avenue, and South Point Estates area. The board took no reportable action in closed session.
Okay, thank you. Next item up is department item number 4. Madam Clerk, will you please read that item into the record?
Chair Nelson and members of the board, departmental item number 4 is from Planning and Development. It is a hearing to consider recommendations regarding the JCC Randall LLC appeal of the Planning Commission's approval of the Santa Rita Holdings, Inc. Cannabis Cultivation Project, case number 12 APL 31, and this is in the 4th District.
All right, before we go to staff, ex parte communications from the board. Supervisor Williams?
I had a phone call with the applicant's planner.
All right, thank you. Supervisor Lavanino?
Don't believe I've had any contact.
Supervisor Hartman?
And I also had a phone conversation yesterday with Kathleen, and I can't remember her last name, but the planner agent for the cannabis grower.
All right, thank you. Supervisor Hart?
I do not have an ex parte communication.
All right. And I do not have any ex parte communication nor emails or calls about this project at all. So with that, let's go ahead and go to staff. Mr. Stewart? Oh, sorry, Director Plowman.
Mr. Chair, members of the board, thank you. I do have Deputy Director Travis Sewards, Supervising Planner Joe Dargle, and the planner on the case, Gwen Byler, that are on Zoom today, but I was just going to introduce the item. This is an appeal of a conditional use permit that was approved by the Planning Commission back in June. And it is an application for 2.54 acres of cannabis cultivation. It's currently a non-conforming use, and the decision was appealed to the board. With that, I will turn it over to, I think, Ms. Byler, who's here to present.
Good afternoon, Mr. Chair and members of the board. I will wait for the presentation to be up. It looks like it is.
Ms. Byler, unfortunately, we cannot hear you. Are you near your microphone or is it muted? I see you're unmuted on Zoom.
Okay, yeah, you can't hear me at all? No, nothing. All right, what's going on here? Okay, still can't hear me?
We can hear you now.
We can hear you now.
Okay, great. Thank you.
Please proceed.
Okay, can you still hear me?
We can.
Okay, thanks. I wanted to make sure the test worked properly. All right, well, thank you for bearing with me. Good afternoon, Mr. Chair and members of the board. My name is Gwen Baylor, and I will be presenting the J.C. Crandall LLC appeal of the Santa Rita Holdings Cannabis Project. On June 9th, the County Planning Commission granted approval of the project, and on June 18th, J.C. Crandall LLC filed an appeal. Next slide, please.
One moment.
It shows like that.
Thank you.
It's not.
Let's go ahead and pause staff's time. For the public watching, we have a few technical difficulties that we're working on resolving. Please bear with us. Okay, back to Ms. Baylor.
Thank you. The 120-acre subject property shown in orange on the graphic before you is located 7 miles west of Buellton, 6 miles east of Lompoc, and 1 mile north of Highway 246. The property is surrounded by parcels zoned Ag 2 100, and surrounding uses include grazing, irrigated crops, and vineyards. The project site is a 3-acre area shown in dark green. Access to the site is provided by Santa Rita Road, which passes through the Campbell Road EDRN and turns into a private road half a mile west of the subject parcel. Next slide, please. The proposed project is for 2.54 acres of cultivation, including 1.88 acres of mature cultivation under 14-foot tall hoops, 0.55 acres of mature cultivation without hoops, and 0.11 acres of nursery cultivation. The project would have up to 3 regular employees who will live on site in a legal non-conforming dwelling. There would be up to 12 additional employees during harvest, which would take place 3 times per year and last 3 days each time. The project would utilize an as-built shed for storage of pesticides, equipment, and materials. Weighing and tagging of harvested cannabis would take place under an as-built tractor shade structure prior to being loaded onto refrigerated trucks for transport off-site. The project includes additional fencing, motion sensor security lighting, and aromatic landscaping. The project proposes to use 1 acre-foot per year of water, and water will continue to be provided by the Vista Hills Mutual Water Company, which draws from the Lompoc Upland Subbasin of the Santa Ynez River Groundwater Basin. The project does not include on-site processing, new structures, or grading. Next slide, please. This slide shows an overview of the project area showing the mature cultivation under hoops outlined in dark green. The mature cultivation without hoops would be in 3 separate areas shown in dark green, and the nursery area is shown in light green. The open-sided structure for weighing and tagging is shown in orange, and the storage shed is located underneath the tractor shed. The dwelling and a shed that is not part of the project are shown in black. Water tanks are shown in blue. Next slide, please. An odor abatement plan is required for the proposed project because it is for a conditional use permit. The OAP is certified by a certified industrial hygienist and specifies that the primary odor emitting activity will be harvesting mature plants 3 times annually. No processing will occur on site. Cannabis will be frozen in refrigerated trucks prior to being trucked off site. The project includes 2,780 square feet of sweet lavender along the west property line. Wind in this area usually blows from west to east toward the hills, which are largely undeveloped and used for grazing. In the event that wind blows toward the west in the direction of the nearest vineyard, which is over 1,300 feet from the project area, the ends of the hoops will be closed off with plastic sheeting. Next slide. If an odor complaint is made, an assessment would be undertaken and would evaluate wind conditions and meteorological data. As outlined in the OAP, the nearest residential zone is 2.8 miles to the west, and the nearest residential zone to the east is over 9 miles away. Next slide, please. I will now present an overview of the appeal issues and staff's responses, which are addressed in full in the board agenda letter. The appellant cited 5 issues as the basis of the appeal. For appeal issue 1, the appellant states that the proposed project is not consistent with the LUDC. In response, staff finds that the project is consistent with all applicable sections of the LUDC. The project meets the intent of the Ag 2 zone and the zone requirements for setbacks, height, and uses. Consistent with the cannabis regulations, the project is required to comply with fencing, lighting, water efficiency, transportation demand, odor abatement, and biological resources requirements. No lighting will be associated with the hoop structures, and they will not have any permanent elements. Next slide. For appeal issue 2, the appellant states that the project is not consistent with state law and that the project is in violation of the California Business and Professional Code, which states that an applicant for a state cannabis license shall provide evidence of the legal right to use the proposed location. The appellant contends that the access easement over the private portion of Santa Rita Road crossing over the appellant's property does not authorize the transportation of cannabis. In response, staff finds that the project shall comply with state law as required by the LUDC. In order to conduct a commercial cannabis business in the county, businesses must obtain state licenses. An applicant for a state cannabis license must show proof that the property owner has consented to commercial cannabis activities. The property owner has consented to permit the project. The subject property was granted an access easement, demonstrating adequate access consistent with the comprehensive plan. Any disagreement regarding the scope of the easement or its burdening of the underlying property is a civil matter and is outside the scope of the county's permit review. Next slide, please. For Appeal Issue 3, the appellant states that the Planning Commission's approval is not supported by evidence in the record. Findings for approval cannot be made, and the project has no legal access. In response, staff finds that the Planning Commission's approval is supported by evidence in the record, and all findings can be made, as described in detail in Attachment 1 to the Board Agenda Letter. In summary, the 120-acre parcel is adequate to accommodate the 2.54-acre cannabis project. Impacts will be mitigated to the maximum extent feasible, demonstrated by the CEQA checklist. Regular employees will live on site, and the project is not visible to public areas. The operation conforms to the comprehensive plan. Next slide, please. For Appeal Issue 4, the appellant states that the county cannot make the required CEQA findings and that the Planning Commission overlooked significant issues that are not addressed in the cannabis PEIR. The appellant contends that staff failed to address deficiencies in the CEQA checklist and states that the applicant did not submit documentation from the State Water Resources Control Board or a Phase 1 cultural study. In response, staff finds that the county can make all required CEQA findings and that the Planning Commission did not overlook environmental issues. Staff prepared a CEQA checklist that addresses all potential impacts and mitigation measures set forth in the PEIR. The CEQA checklist acknowledges that the required documentation from the State Water Board and the confidential Phase 1 cultural resources study were submitted for the project. Next slide, please. For Appeal Issue 5, the appellant states that the Planning Commission approved the project in a truncated and rushed manner, depriving the appellant of a fair and impartial hearing. In response, staff finds that the Planning Commission approved the project with a vote of 5-0 at the June 9th hearing. Required notice of the hearing was provided, and the hearing followed all procedural standards outlined in the Planning Commission Procedures Manual. The appellant provided written and oral comments. After hearing the staff presentation, applicant presentation, public testimony, and considering the evidence in the record, the Planning Commission approved the project. Next slide, please. In conclusion, staff recommends the board deny the appeal, make the required findings for approval, determine the PEIR is adequate and subsequent environmental review is not required, and grant de novo approval of the project, subject to the conditions set forth in Attachment 2 of the Board Agenda Letter. This concludes staff's presentation. We're available for any questions. Thank you.
Thank you, Ms. Baylor. Are there any questions from the board for Ms. Baylor? Okay, seeing none, at this time, a presentation by the appellants. I think we have Mr. Guadiana.
And Ernest, if you could please unmute yourself and begin your comments.
I believe we had a PowerPoint sent in, so just let me know when that is up. All right, perfect.
Mr. Guadiana, you'll have 10 minutes to present.
Thank you. Good afternoon. My name is Ernest Guadiana, and I represent J.C. Crandall, LLC, and its appeal of Santa Rita Holdings conditional use permit. Now, although we appealed the permit on multiple grounds, our main argument applies to this easement and the county's decision to allow a commercial cannabis activity over my client's property without my client's consent. Now, during the Planning Commission meeting, one of the commissioners when this argument was raised, dismissed it on the basis that this was a issue that likely had been litigated numerous times, and therefore the county's position must have been correct. I want to emphasize that this is a novel issue. It's our understanding that this is the first time this issue has ever been raised. And for that reason, we believe that the Planning Commission erroneously approved the permit. Additionally, County Council reiterated that this was purely a state licensing requirement issue and had no bearing on the land use approval. And again, we believe that when the county is allowing a federally prohibited action over my client's property without my client's consent, that is something that should be addressed at the land use permitting process. Now, to give you a better understanding of the properties at issue, I'd like to show you an overview. Can you please go to the next slide? So this is an aerial of the properties. As you'll see in gray, there's Santa Rita Road, which is the public access way. It ends at the Jackson Family Wines property, which is outlined in white, and then traverses through the Jackson Family Wines property onto my client's property, which is outlined in red, and then onto the property that is being utilized by Santa Rita Holdings and owned by Kim Hughes, which is outlined in yellow. Next slide, please. Now, this is an overview showing the portion of the road that traverses my client's property. It is outlined in blue, my client's property, and then the road is also outlined in blue. The portion of the easement road that crosses Jackson Family Wines property is outlined in pink. Now, here the county relies on an easement from 1988 to determine that the applicant has the right to transport cannabis over the property. Now, although the easement does not expressly prohibit cannabis transportation, we note that the easement was entered into before cannabis was allowed at the state level. Now, generally, we would agree that an access easement is sufficient to show access required for a use permit such as here. However, the main issue involves the quasi-legal nature of cannabis, which complicates this general rule. Now, specifically, cannabis remains illegal at the federal level. It is listed as a Schedule I drug under the Controlled Substances Act. And due to this federal prohibition on cannabis, my client's property, or any property, including my client's property, used to facilitate commercial cannabis activities can subject that property to federal asset forfeiture laws and create a risk that the federal government would seize such a property as my client's. Moreover, property owners can be charged with aiding and abetting any violations of the Controlled Substances Act. So again, my client would be subject to potential aiding and abetting violations under the Controlled Substances Act by allowing commercial cannabis activity over her property. Now, California, when understanding these issues with the quasi-legal nature of cannabis, the legislature specifically required each property owner's authorization as a prerequisite before allowing cannabis activities to occur over one's property. Now, specifically, the rule cited in the staff report provides that an applicant for any type of license must provide a statement from a landowner of real property or that landowner's agent where the commercial cannabis activity will occur as proof to demonstrate the landowner has acknowledged and consented to permitted commercial cannabis activities over the property. Now, such a requirement ensures that any property owner sufficiently acknowledges and consents to a cannabis activity. Now, I want to make a distinction here, and that is that this is a private road and not a public road. Santa Rita Road, for example, is a public road which the cannabis rules specifically authorize transportation over. It prevents any municipal agency from trying to stand in the way of cannabis transportation. However, there's no similar rule for private easement roads such as this. And as a result, the general rule that consent of a property owner must be obtained still applies. Now, again, we believe that the county is subjecting my clients to federally illegal activities without their consent. Now, such a decision is not only allowed under state law, is not only disallowed under state law, but even potentially constitutes an illegal taking by authorizing an illegal activity over my client's property. Now, for this reason alone, we believe that the appeal should be granted and the conditional use permit denied. Can we go to the next slide? Now, even if my clients were to consent, we also believe that the condition of the roads are not sufficient to support the proposed cannabis transportation. On this slide is a picture of the roadway, which shows just how narrow this roadway is and kind of shows how these cannabis transportation trucks are utilizing the entirety of the road. Next slide. This again shows how narrow these roads are, and they are dirt roads. They're not heavily improved, and we believe that these are not sufficient for the types of vehicles which will be using this road to transport cannabis. Next slide, please. Specifically, we've seen big rigs being utilized for cannabis transportation, and again, we just do not believe that this road is up to standards. As a result, we would anticipate that the board should, at a very minimum, condition any approval of the application on the applicant improving and widening this easement road to ensure that the trucks do not impact the road. Next slide, please. Now, additionally, the applicant, although this was preliminarily approved at the June 7th hearing, is not adhering to any of the conditions of approval, or at least a number of them. Specifically, the applicant is currently growing within the 50-foot setback area. Next slide, please. This slide shows the overlap of the cannabis activities that are not only outside of the state license area, but are also within the setback area. They're circled in green. Next slide, please. Next slide, please. Sorry, I think there was one right before this. Perfect. And this is also a new grow that is occurring in a leach field per the site plan, at least. And this is 100% within the setback area. We believe that the applicant will continue to fail to conform to the proposed CUP conditions, and we believe that such violations only will be exacerbated should this appeal be denied. Next slide, please. This is also showing activities occurring outside of the permitted hours, which I believe are up until 4:30 p.m. Next slide, please. This is a cannabis transportation truck that was utilizing the road at 11:41 p.m. Again, we have issues with the potential violations that we believe will be occurring on this property. Next slide, please. Now, although the staff report noted that there was sufficient water for this property, we actually believe that that is contrary to the statements of the water company. Next slide, please. So this is the letter that was relied upon by staff when determining that water was sufficient. Next slide, please. So I'm highlighting some language in this letter. I realize it's quite fuzzy in the on this, but let me read it for you. So it specifically states, let me add that water delivery to your property is a variable quantity, an allotment determined annually and listed on your water bill. A decade of drought and other constraints compel us to maintain flexibility in the allotment we assign to each share of ownership. Beyond that, you share a common infrastructure with 24 homes, and in the face of unforeseen problems, our focus must always remain on household domestic use and agricultural interests. Next slide, please. The letter goes on to say, we might hope that your allotment at 15 shares is sufficient to the project you described, but we cannot in good faith attest to that. We simply do not have the agricultural experience or savvy to make that call. Perhaps a more detailed survey would be useful to us all. Now, even though the water companies expressly requested additional analysis of this issue, none was done, and it is our belief that shows that significant impacts have not been addressed on this. Next slide, please. We also want to point out this is a printout from the State Water Board's water system details. Next slide, please. And it notes that there is only one agricultural user, which is the applicant, along with 20 residential users. It is our belief that as a result of this, that in the current droughts that we are facing, there will not be sufficient water for this project, or that the use of water by this project will impact residential uses. Next slide, please.
Mr. Guardiana, your time's up. Can you wrap it up here quickly?
Yes, sorry. So the only other things that we wanted to say is that we believe that this also violates CEQA. The applicant noted that he had 5 additional acreage that was going to be utilized, and that was not considered in this project. Next slide, please. And for the reasons stated on this slide, we believe that CEQA was also violated here. Thank you very much.
All right. Thank you, Mr. Guardiana. All right. Any questions for the appellant from the board? Supervisor Lavanino?
Well, I guess a question for county council. Is there any legal basis on their fear of using an easement to move cannabis across that particular easement, across their property? So they're concerned that the easement is not for, it wasn't specifically called out for cannabis. I'm just curious if there's any legal.
Mr. Chair and Supervisor Lavanino, the easement is for access and it will be used for access. Easements typically don't contemplate what you're transporting. So I believe it is adequate access for this project.
Mr. Guardiana, your slide on the road damage, it's difficult, I think, for the board to understand how narrow it is, especially when we only see half the road in the picture. There was one picture of the full entire road. Do you have the road width?
I believe it is at 10 feet.
Okay. All right. Thank you. Any other questions from the board?
It's expressly noted in the easement deed how wide the road is allowed to be, and then what it can be widened to at a later date if required by the county.
All right. Do you have those numbers for me?
Give me 1 second and I will pull it up.
How about you find that and I'll ask you after the rebuttal
Thank you.
period? All right. Thank you. Okay. See no additional questions from the board. Let's go ahead and go to the applicant. I believe we have Mr. Hillebrandt from Santa Rita Holdings Incorporated. Mr. Hillebrandt, you will, because the appellant went over, you'll have 10 minutes and 45 seconds.
Okay.
So that we have equity there.
Great, thank you.
We just hold 1 second while we punch that in. Sorry, we got our clerk working overtime for us here. All right. Thank you. Go, please
Thank
proceed.
you. I may have my lawyer chime in on some of the things that he said. As regard to some of these slides that were shown, there was a large truck, which is a propane truck that feeds the house. Our house runs on propane. There was a large box truck that is not a cannabis transportation truck. That was a friend moving some materials off of our property at that late hour. So a lot of these accusations are a bit unfounded and misinformed. I have a water service determination here from Vista Hills Mutual Water Company saying that this water service determination confirms that the district currently has sufficient water supply available to serve the proposed project. The project parcel has adequate water credit for the forecasted demand. I've also provided county staff with our water bills and the amount of water that we're allotted. And if Josh, you would like to comment on some of the first things that Ernest was saying, possible? Josh is our lawyer.
Yeah, and I'm right here on Zoom. I apologize for being unable to be present. The Honorable Board of Supervisors, may I speak briefly?
Yes, Mr. Lynn, please.
Thank you very much. So I don't want to go over each of the issues. I think it's unnecessary. The staff's well-reasoned report and responses took care of most of it. I'd like to point out a couple of things that have to do just with us and the project. These young men have done an honorable job of really trying to get with what is a fairly complicated program. And only at the last minute we're hit with neighbors they didn't know they had in this manner. The staff can speak to the tone, tenor, and accuracy of each of the communications. I can only speak to mine. Communications I have, and I have no problem with anybody opposing it. It's their right. I absolutely understand it. Opposing counsel has been nothing but genuine and nice in our conversations. What hasn't happened is each of the things that I'm seeing in the presentation today are new to me. I've invited meetings, conversations, phone calls, conference calls, a mediation itself, whatever it took. And we went through the mediative setting the county provided to try to, and I don't mean this in a pejorative way, but educate counsel on the fact that he's just totally incorrect on the law. And the law as the initial basis with respect to the easement seems to be the real hitch in their otherwise cooperative giddy up. And so the one thing I would like to point out is this notion that they could be prosecuted as accomplices or aiding and abetting is not just fundamentally wrong on black letter criminal law, federal, state, or otherwise, but is really the kind of red herring we've seen from the communication a lot. It's been terribly frustrating because even if we disagree, I'm always able to engage folks on the other side and say, hey, look, my role's minimal here. But this issue that the CUP and the LUP are subject, or LUP and anywhere in the county is subject to federal action, silly. I think everybody knows it's not budgeted for federal action. They're not interested. They're not doing it. There literally is no possibility of that occurring. And so that has led to some other assumptions that have been made. And in terms of the genuine frustration that we've experienced in trying to engage these folks in a meaningful conversation about how can we make it, it's going to happen. We believe we're legal, but how can we make it more palatable for you? What can we do to help? And I've gotten literally zero response. I have just dozens of emails that go this way and conversations. So what I'd like to point out about the truck is, and then I'll be quiet, is the absolute duplicity in the argument itself. If you just look at the truck they showed, first of all, it has nothing to do with cannabis. So that's just funny. The other part is they say the road doesn't work. There are big trucks on it. Well, one or the other are true. They can't both be true. Either the truck fits the road or the truck doesn't fit the road. Either the road supports the truck or it doesn't. These commercial vehicles aren't cannabis vehicles. They have nothing to do with the analysis, but they have everything to do with the manner in which it's been presented and why I asked for all these materials ahead of time and I didn't receive them. And I won't speculate as to why, but I can only react in real time. So this notion that cannabis is quasi-legal is not true. In California, it is legal. It's legal on a specific basis like alcohol or fireworks, but it's legal. Everything the county has done in this circumstance has made sense to me with respect to the analysis. I don't have anything to add to the staff's analysis, and I appreciate you letting me take the time to speak with you.
Thank you, Mr. Lynn. Any additional comments from Mr. Hillbrandt or Ms. Ward?
Good afternoon. Yes, as you said, my name is Kathleen Wold. I'm the applicant's representative. I just let them speak first because I tend to be kind of long-winded and I didn't want to use the time. But I'd just like to say that we agree with everything that staff has said in their staff report and the long, very voluminous packet of information. I would like to say that the applicant has been very receptive to anything that the planning department has asked us to do in refining this project down to where it's really tight and operates very tight, whether it be from reducing the acreage, the fencing, the security fencing between the house and the project. We have always responded. With the water issue, the allocation for the water for the Santa Rita Holdings project is not above the threshold for environmental purposes. Let's just be clear on that, which has been an issue with other cannabis projects. This is amount to saying, hey, if there isn't water out there, we're going to give, human the habitability of your home first. And then of course he won't be planting, but in no way and shape is there any question about him using so much water that it's an environmental impact. So with that said, we just like to, I just like to reiterate that we did participate in the facilitation and we thought that we might be able to work out some type of compromise with the easement road. whether it just be some type of maintenance agreement or something of that nature, but we never heard from the appellant's lawyer. So, my client has been very willing to be a good neighbor and do beyond what the conditions of approval have been at this point. And so with that, I'm open to any questions you may have.
Questions from the board? Supervisor Hartman.
The one issue you haven't addressed yet is encroachment into the setback.
Oh, we're not, that's the first I've heard of it. We're not encroaching into the setback. My client, the project right now, since Ms. Crandall has assumed this property, he has been besieged with private security cops out there night and day, drones flying over. They've had their properties surveyed by her. I don't know where all these maps come from and all of this information about setbacks and this and that. The project that as what's been submitted on our plans and reviewed by the planning department is outside the setbacks, the ESH setbacks. Now, you talk about the leach field, they don't have that same cannabis setback. The leach field is for the house. So I'm going to reiterate what the attorney said. There's a lot of information coming in at the very last minute, but I think that the county has done a really diligent review of our project, and we have been able to show that we're outside every setback. Now, he is growing non-conforming, so he isn't conforming possibly right at this moment to the conditions. That might be true.
We've also had several surveys done. Originally, when we moved into the property, we thought where our property line was about 20 yards past where it was. Once we got a survey done and learned where it was, we stepped back and built a fence well past where the property line was. The appellant also got a survey done and claims that the surveys are somehow different. When you put them back to back, they're exactly the same. And so we've gone back and forth with where is the actual property line, taking that tape measures and going from where their survey is out to where our field starts and doing the 50-yard setback from the property line on and on. So there has been some confusion, but we are doing our best, as far as I know, by abiding by that setback. But there's been multiple surveys done because of all of this confusion. So that's about it.
All right. Thank you, Mr. Hillebrand. Any other questions from the board? I guess I have actually, Ms. Wold. So I understand that the maintenance agreement hasn't taken place because you don't have a willing participant next to you. What would have been the offer from the applicant for a maintenance agreement?
We were looking for them to make the proposal because it's their issue, correct? So we weren't trying to dictate to them. We were willing to accept what they had. In fact, after hearing a month had passed by and we hadn't heard anything, we actually reached back out to them. And that was where we were going with them is we can't compromise over whether or not you're an opponent or you oppose cannabis. But if you look beyond that issue, we can go to the next one. And we were willing to do that. We never had a proposal from them.
Okay. All right. Thank you very much. Okay, at this time, I believe that it is time for public comment on this item. Madam Clerk, is there any public comment?
Chair Nelson and members of the board, we have 2 requests to speak on this item. Unfortunately, both our requests to speak have not logged into Zoom. So if you are a member of the public and you would like to provide public comment on this item, departmental item number 4 for the Santa Rita Hills Cannabis Cultivation Appeal, please do so now.
And we don't have any public commenters in the room in Santa Barbara or here at this time?
Chair Nelson and members of the board, that is correct. We only have 2 requests to speak on Zoom.
All right. Okay, I'm not seeing anybody pop online. Can you confirm that to be true?
Chair Nelson and members of the board, that is correct. I did resend the confirmation emails as well, and I am not seeing them on Zoom.
All right, thank you. All right, that concludes public comment on this item. Unfortunately, the pre-scheduled public commenters were unable to participate through our Zoom system today. At this time, it's now time for rebuttal. We'll first start with the appellant, and you'll have 5 minutes.
Thank you. So going back to what the applicant stated just now, our main issue here really is that my client does not want to permit cannabis going over her property without her consent. We believe that that is the main issue here. And although counsel for applicant has stated that there is no chance of this occurring, there are still laws that address this specific issue, and the federal government can still enforce those laws. That is our position. And while in regards to the water, we have never seen the letter from Vista saying that they do have sufficient capacity. Assuming that that is true, we understand that would likely fix this issue. However, this is something that we've never seen before. In regarding to your question about the roadway, under the easement deed, it was stated that it is a 12-foot private road. It's our understanding that it's been narrowed by about a foot.
Okay, thank you, Mr. Thank you, Mr. Guadiana. Any further questions for the appellant from the board? All right, applicant for rebuttal.
Sure. I'm not sure if Josh, you would like to say anything to that. Otherwise, I can.
I don't have anything to say. Thank you very much to the board for offering me the opportunity again. I appreciate it.
Okay. I guess I'd just like to say, and to wrap it up, we're a small project. We're 2.5 acres off the beaten path, out of public sight. I feel like there's a lot of large grows in our immediate neighborhood. There's 50 acres on the 246 here, 40 acres there. We're 2.5 tucked away, kind of up in the middle of nowhere. And I feel like the community wants to see that type of project. Small 2.5 acres. We're a boutique project. There's not a lot of traffic. We don't have trucks in and out all day and all night like they're trying to show. And I think like we can be a model for what a Santa Cruz grow should be. I mean, a Santa Barbara grow should be. I've spent the past 6 months working with a lot of winemakers in the area and other cannabis stakeholders to try to figure out some of these issues that have come between us, and we're making a lot of progress there. I've got a good relationship with Kendall Jackson, who's our nearest vineyard. So as far as all that kind of stuff is concerned, I think that we're making a lot of headway and that we've got a great relationship with our neighbors. In 5 years, we haven't had a single complaint, odor, traffic, nothing from the people who actually live there. The Crandalls live in San Francisco and they own a piece of property between us and the road. I get their complaints, but for everyone who actually lives in our neighborhood, we all get along and we've never had a single complaint. So with that, I'd just like to say thank you for your time and appreciate it.
Thank you, Mr. Hillenbrand. Supervisor Hartman?
Oh,
question?
does someone live on your property?
Yes, 3 of us live on our property, which actually cuts down the amount of traffic in and out. Thank you.
Thank you, Mr. Hillenbrand. Any additional questions from the board? All right, back to staff.
Mr. Chair, members of the board, I believe Ms. Baylor has a response to some of the comments that were made by the appellant.
Yeah, that'd be very helpful. Ms. Baylor, please.
Mr. Chair, members of the board, thank you for the opportunity to respond. So I just have a few issues that I want to relay based on the comments that were made. Regarding the road, so the project was reviewed by County Fire and County Roads, and neither department required any improvements to the existing 12-foot wide road. The employees live on site, and so there will not be daily commuting traffic except for during harvests. There will be 3 harvests per year, and each harvest will last only 3 days. Now, regarding water, I want to clarify that the Vista Hills Mutual Water Company provides adequate water for the site. They allot the parcel 15 shares, which is equal to over 17 acre-feet per year. Now, the threshold for this basin, according to the county's Environmental Thresholds and Guidelines Manual, is 12 acre-feet per year. And the project proposes to use 1 acre-feet per year. So the fact that it's such a small grow and they're going to be using the required water efficient methods for their irrigation mean that they're going to be well below the threshold and also well below the allotment provided by the Vista Hills Mutual Water Company. Regarding the setbacks, I want to acknowledge that the agricultural zone, so this is in the Ag 2 zone, the Ag 2 zone doesn't have any side or rear setbacks. So there are no setback violations. The project is compliant with all cannabis setbacks. And lastly, I want to touch on the biological resources. So the robust biological resources assessment for the project affirms that the project is not located in any setback areas for the ephemeral drainage on site. The hoops and the cultivation comply with all required setbacks for watersheds and drainages. The California Department of Fish and Wildlife has worked really closely with the applicant throughout their permit process, and there are no violations with the county or CDFW for any kind of biological resources. So hope that helps clarify some of the points that were brought up, and I'm available to answer any additional questions you may have.
Thank you, Ms. Baylor. Is there any questions for Ms. Baylor from the board? All right. Seeing no questions from the board at this time, we'll begin board deliberations on this. Well, it's my district, so I'll jump in. It's such a rare thing for me. When this item came to our office this last week, when we got our board presentation, it took us a little while to figure out where it's at. We also went through all our emails to see if we had any correspondence with anybody in the community about this project. And it was empty. We didn't see anything there. So then that we didn't have any history. For the public, there's a lot of projects out there that have a lot of attention. A lot of people in favor, a lot of people opposed. And this project has lacked that level of controversy. Also, as this project moves forward, this is one of the first, or maybe it's the second CUP that's come to the board since I've been on it here over this last year. Most of the time we have an LUP that comes to the board, and with an LUP, the required findings this board have to make are pretty low. We just have to make sure all the boxes were checked and staff didn't err. If that's the case, our board is legally required to make those findings and approve the project. This being a CUP gives us a lot more liberty as we proceed and looking at, does this project really work? Is it in the right location? Does it have the right setbacks? Does it have the same kind of impacts? And, looking at this project, I had a difficult time finding those issues. The appellant came today with a laundry list of things that for them to oppose it on. I didn't think many of them held much water. The idea that this project only has 1 acre-foot of water being used is a very small impact, especially as we just have heard from Ms. Baylor. That's 1/17 of the allocation that they have for this property. Sounds like they might waste more water or use more water with some horse troughs and cow troughs and other uses on the property. And for the public, 1 acre-feet of water is equivalent to about 2 houses. So for people to kind of get that scale ability. So I'm not concerned about the water. The road is tenuous, but I think that's at your own risk type of situation. It is an easement. It seems like it's been traveled across as we've seen the propane trucks, and I'm sure there's cattle trailers that have come across that as well over the years. It seems like with many of the workers living on site, there's going to be very little traffic across that. And I think it really would be something, if this project is approved by the board, I hope that the applicant sincerely continues to work with their neighbor. I find that some appellants will not work with somebody up until the very end because they don't want to hold out any hope. They want to make sure that they're not seen to be agreeing. So it's kind of all or nothing. I think that's a bad strategy for negotiating. Half of nothing is I guess still nothing. And I hope that if this project is approved, that you guys as neighbors continue to work together. I think it's also remarkable that you're not seeing, as we saw, there's 20 residents in this water company, and none of them are here today to speak on this item. I think I've seen any items in the record of their opposition. So, as we look at this project, And also where it's located is not in the direction of, again, being a small grow of some of the wineries and the vineyards, like other projects that have been proposed and have been before this board. So with all that, I can't, even though we have a lot of discretion with the CP, I can't find anything that I would do differently on your project, and I'm inclined to support it. Supervisor Hartman and then Supervisor Hart.
I'm inclined to agree with you. You live and work on the site. It's a very small grow off the beaten path. There haven't been any complaints. And the plant, although we can hear this de novo, starting from scratch, the Planning Commission voted 5-0, and they spend a lot of time on these cases. So that speaks loudly to me. I share concern about a road maintenance agreement. Would think that would already be in place. But, you know, you have to figure out how to use that road and keep it up. But to me, it seems like exactly what you said, the kind of project we would like to see in the county.
All right, Supervisor Hart and Supervisor Lavanino.
Yeah, I agree with my colleagues, and I think the applicant said it really well. Just a very small grow, just off the beaten path, with no neighbors that live nearby that have expressed any concerns, despite operating for a number of years. And I support the project as well.
Thank you, Supervisor Lavanino, then Supervisor Williams.
Thank you, Mr. Chair. I think this also puts to bed the fallacy that we tell people, hey, go out in the middle of nowhere and grow this and grow a small thing and you won't have any problems, because everywhere has somebody that has an issue. Some issues are better than others. You know what jumped out at me today? First off, public policy is messy. The reason why we go through these hearings is because we have to err on the side of public participation and transparency. But I think to anybody watching today, this really just seemed unnecessary. And the unfortunate side of this is, I mean, everybody, if you own a piece of property, you have the ability and you have the right to have your day at a hearing. But what's wrong with this is for $701, somebody can file an appeal. And this cost us, I think it was 75 hours of staff time and $19,000 to have this hearing. So, you know, I've heard many well-reasoned appellant complaints in the past, whether it was odor, concentration, traffic, those all make a lot of sense to me. But this was the first time I heard that, you know, you might be able to be charged with aiding and abetting for allowing somebody to drive cannabis over your easement. So the project to me is a no-brainer. This should have just sailed through. This is exactly what we're looking for. And the fact that it had to come all the way here and go through the Planning Commission and the Board of Supervisors and get appealed all the way up is kind of sad, because there are other projects that are not as attractive that have gone through without coming all this way before and gotten appealed all the way. So I do support the project.
Thank you, Supervisor Lavanino. Supervisor Williams.
I also support the project. I mean, it's I like to see smaller operations be able to go forward and have some of the prosperity of this crop be shared. You know, I agree that it always means you need more eyes on things, because some people won't act according to the rules. But I think that this is obviously a good location for minimizing nuisance, and you know, I think it should be supported. It's modest, and you know, frankly, I wish we had more smaller grows and less big ones.
Right. Thank you, Supervisor Williams. So let me just ask my vice chair. So as chair, am I allowed to make the motion here, even though it's in my district? All right. I'm gonna make the motion that we deny the appeal and approve the project. I believe it's staff recommendations.
And I would second.
Okay. Any further discussion? Seeing none, all in favor, signify by saying aye. Aye.
Aye.
Motion passes unanimously. All right. Congratulations. Right. Well, that concludes today's meeting. We are now adjourned to Tuesday, October 5th, 2021 in Santa Barbara. Have a good night.